Welcome to the Grahya Second Day National Seminar, paper and poster presentation. Before presentation, all the best our dear presenters. I would like to invite our paper presentation coordinator, Dr. Aishwarya RS. Dr. Aishwarya?
Thank you, Dr. Sabin. Once again, a warm welcome to one and all. I welcome to everyone Grahya Second Day National Level Paper and Poster Presentation presented by Team Ayurapta. Before get start, I would like to invite each and every faculty members to this presentation. Without much delay, we can start the presentation. And first, we have a paper presentation. For that, I invite Dr. Rekha Raut. Dr. Rekha.
Hello, ma'am. Good evening, everyone. Hello, can you hear me, ma'am?
Yes, doctor, you are audible.
Yes, I'm sharing the screen now. Hello, good evening, everyone. I'm Dr. Rekha Prakash Raut from CRC College, Nigri, Pune. Here is my topic of paper presentation is physiology of skin. Introduction. Skin is the largest organ of body. Average thickness of skin is about 1 to 2 mm, considerably thick at and in the sole of foot, palm of the hand, and in the interscapular region, measuring about 5 mm. It is the thinnest over eyelids and penis, measuring about 0.5 mm. तस्य खल्वे प्रवृतस्य शुक्रशोणितस्य अभिप्रपच्यमानस्य शिरस्यैव सन्तानिकाः सप्तत्वच भवन्ति. Here we see tvacha prakara. According to Charaka, Kashyapa, Ashtanghrudaya, there are 6 types of skin, that is tvacha. According to Sushrut and Ayurvedic Samhita, there are 7 types of tvacha. And according to modern, there are 7 types of tvacha. Charak tvacha prakara. First one is Udagdhara, Ashrukdhara, Sidma Kilasa, Dadrukushtha, Alaji, Vidradi, and Arunshika. According to Sushruta, tvacha prakara are 7. First one is Avbhasini. It includes Vadi, Sigma, Padma, Kantaka, and the thickness is 1/18 Brihi. Second one is Lohita, Tilakalak, Nyachyavenga, 1/16 Brihi. Third one is Shweta, Charmadal, Ajgallika, Mashaka. Thickness is 1/12 Brihi. Fourth one is Tambra, Kilas Kushta, 1/8 Brihi. Fifth one is Vedini, Kushta Visarpa, 1/5 Brihi. Sixth one is Rohini. It includes Apachi, Arbuch, Lipat, Vadi. Its thickness is 1 Brihi. And seventh tvacha is Mansdhara. It includes Galaganda, Bagandhar, Vidradi, Arsha, and thickness is 2 Brihi. Here we see layer of the skin. Skin is made up of 2 layers, outer epidermis and inner dermis. First one is outer epidermis. It is formed by stratified epithelium, which is made up of 5 layers. First one, stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, stratum germina vaticum. Epidermis doesn't have blood vessels. Nutrition is provided by the capillaries of dermis. First one is stratum corneum, that is, it is horny layer. It is the outermost layer, consists of dead cells, which are called corneocytes. These cells contains keratin, phospholipids, and glycogen. Second one is stratum lucidum, that is, lucid means clear. It is present only in the thick skin of areas such as fingertips, palms, and soles. The layer looks like homogeneous translucent zone. It consists of flattened, clear, dead keratinocytes. Third one is stratum granulosum. This is the thin layer within 2 to 5 rows of flattened rhomboid cells. The cytoplasm contains darkly staining granules of protein called keratohyalin. Stratum spinosum, that is prickle cell layer. The cell of this layer possesses some spine-like protoplasmic projection. By this projection, the cells are connected to one another. These arrangements provides both strength and flexibility to the skin. Fifth one is stratum germinativum. It is the deepest thin layer of epidermis. From this layer, some projection extend down up to dermis. This projection provide anchoring and nutrition function. The color of the skin depends upon the cell of this layer, which contains the pigment melanin. Epidermis contains 4 types of cells. First one, keratinocytes. It is 90% produce keratin. Second one is melanocyte, 8% produce melanin. Melanin is a yellow or brown black pigment that contributes to skin color and absorbs damaging ultraviolet lights. Third one is Langerhans cells. These arise from red bone marrow and migrates to the epidermis. Fourth one, Merkel cells located in the deepest layer of epidermis. Merkel cells or Merkel disc detect touch sensations. Innermost layer is dermis. Dermis of skin is connective tissue layer made up of collagen fiber, fibroblasts, and histiocytes. The collagen fibers contains the enzymes collagenase, which is responsible for wound healing. Dermis is made up of 2 layers. First one, papillary layer. Second one, reticular layer. First one is papillary layer. It is superficial layer, contains blood vessels, lymphatics, and nerve fibers. It has some pigment containing cells known as chromatophores. Reticular layer made up of reticular and elastic fibers. These fibers are found around the hair bulbs, sweat glands, and sebaceous glands. Prakruti Tvacha Varnana. We know the 3 doshas, Vata, Pitta, Kapha. Vata include, in case of Vata Prakruti, the Tvacha Varnana, Ruksha and Nisteja. In case of Pitta, the Mrudu, Ushna and Tila Yukta. And in case of Kapha Prakruti, Snigdha Tvacha. Color of the skin. Color of the skin depends upon the 2 important factors, pigment of skin and hemoglobin in the blood. Pigment of skin, it is brown pigment called melanin. Melanin is synthesized by melanocytes, which are present mostly in stratum germinativum and stratum spinosum of epidermis. Melanin, it is a protein in nature and synthesized by amino acid tyrosine via hydrophenylalanine, that is DOPA. Skin becomes dark if melanin content is increased. Hemoglobin in the blood is second important factor of color of skin. Paleness of skin, that is anemia, decreased hemoglobin. Bluish color of skin, that is cyanosis, excessive amount of reduced hemoglobin. Pink color of skin, that is rush of blood due to the cutaneous vasodilation, that is blushing. Here we see function of skin, protective function, protection from bacteria and toxic substances, protection from mechanical blow, protection from ultraviolet rays. Second, sensory function, sensation of touch, pain, pressure, and temperature. Third, storage function. Skin can store fat, water, chloride, and sugar. Synthetic function, vitamin D3 synthesized in skin by action of ultraviolet rays on cholesterol. Regulation of body temperature. Skin plays an important role in the regulation of body temperature. Sweat glands of skin take active part in heat loss by secreting sweat. The lipid content of sebum prevents loss of heat from the body in the cold environment. 6.1 regulation of water and electrolyte balance. 7 excretory function. Skin excrete waste material like urea, salt, and fatty substances. 8 absorptive function. It absorbs fat soluble substances and some ointments. 9 secretory function. Secretes sweat through the sweat gland and sebum through sebaceous gland. Sweda Sneha Granthi. Function of Sweda and Sneha Granthi. It is performed by Prajak Pitta. Sweda Karya, Sweda Kleda Sokumaryat. Reference Sushru Sutrasan 15/5. Sweda Pramana is 10 Anjali. Swedva Strotas, Mala Swedastu Medasa. Reference Charak Chikisa 15/18. Sweda Vahanam Srotasam Medomulam Loma Kupascha. Reference Charak Viman 5/8. Swedva Strotas Dushti Karane. व्यायामात अतिसंतापात शीतोनात शीत उष्ण क्रमसेवनात स्वेदवाहिनी दुष्रंती क्रोध शोक भयस्तथा. रेफरेन्सेस चरक विमान 5/22. स्वेदवा स्रोतस दुष्टि लक्षण अस्वेदनम अतिस्वेदनम पारुष्यम अतिश लक्षणताम अंगस्य परिदाह लोमहर्ष च दृष्ट्वा स्वेदवाहनस्य प्रदुष्टनीति विद्यात. रेफरेन्सेस चरक चिकित्सा 5/8. then we see स्वेदक्षय लक्षण. स्वेदक्षय स्तब्ध रोम कुपता त्वकशोष स्पर्श वैगुण्यम स्वेदनाशश्च तत्र अभ्यंग स्वेद उपयोगश्च. रेफरेन्स सुश्रुत सूत्रस्थान 15/11. स्वेदः रोमश्च्युति Sabdaromata Sputanum Tocha. Reference Ashtang Hruday Sutrasthan 11/22. Svedaruddhi Lakshana Sveda Atiruddha Tvacho. Dorgandhyasya Kandu cha Apadayati. Reference Sushru Sutrasthan 15/15. Skin contains two types of gland, that is sebaceous gland and sweat gland. Sebaceous gland situated at dermis of the skin at the side of hair follicle, shape ovoid or spherical in shape. This gland develop from hair follicle, so the sebaceous glands are absent over the thick skin. Opens into the neck of hair follicle by means of duct. The sebaceous glands open directly into the exterior in some areas like face, lips, nipple, glans penis, and labia minora. Sebum. Sebaceous gland secretes an oily substance called sebum. Sebum contains free fatty acids, triglycerides, squalene, sterols, waxes, and paraffin. Functions of sebaceous gland. Sebum has antibacterial and antifungal actions. Thus, it prevents the infection of skin by bacteria and fungi. The lipid of sebum keeps the skin smooth and oily and prevents heat loss from the body. Sebaceous gland at puberty. The sebaceous glands are stimulated by sex hormones in both female and male. In male, due to the increased secretion of dihydroepiandrosterone, the sebaceous glands are stimulated suddenly, leading to the development of acne over the skin at the time of puberty. Then sweat gland. Sweat glands are of two types: exocrine, that is merocrine glands, and apocrine glands. Here we see the aspects of exocrine and apocrine glands. Number one, distribution. Exocrine glands distributed throughout the body, and in case of apocrine gland, only oily in limited areas like axilla and pubis. Opening extended through sweat pore, and here into hair follicle. Period of function throughout the life, and here start functioning only at puberty. Secretion clear and watery, and apocrine glands thick and milky. Regulation of body temperature. Exocrine gland plays an important role in regulating body temperature, while apocrine glands do not play any role in regulating body temperature. Conditions when secretion is increased. Exocrine glands during increased temperature and emotional conditions, and in case of apocrine glands only during emotional conditions. Control of secretory activity. In case of exocrine gland under the nervous control, and apocrine gland under hormonal control. Nerve supply, sympathetic cholinergic fibers, and apocrine glands, sympathetic adrenergic fibers. Sweat. Insensible perspiration. We are not aware about this water loss. It is 300 to 400 ml per day. Sensible perspiration. We are aware of it. That is, it is called as sweating. Normal volume of sweat is 100 ml per day. Nervous control, sympathetic nervous control. pH is 4 to 6.8. Specific gravity of sweat is 1.001 to 1.008. Composition of sweat: water 99%, sodium chloride 0.9 gram per liter, potassium 0.2 gram per liter, calcium 0.15 gram per liter, magnesium 0.0013 gram per liter, urea, amino acids, bicarbonate, minerals, and lactic acids. Trace metals are zinc 0.4 mg per liter, chromium 0.1, copper 0.1 to 0.8 mg per L, iron 1 mg per liter, nickel 0.05, and lead 0.5. Pheromones. Pheromones are the chemical substances which, when secreted into the environment by an individual, cause some behavioral or physiological changes in the other individuals of the same species. Pheromones are mostly present in urine, vaginal fluid, and other secretions of mammals, and influence the behavior and reproductive cycles in these animals. Recently, it is found that the pheromones excreted in axilla of one woman affects the menstrual cycle of her roommate or other woman living with her. Thank you.
Thank you, Doctor. Next, I invite Dr. Saylee Kathane for the paper presentation on the topic Triphala, the Ayurvedic approach to your screen problems. Dr. Saylee, are you there?
Good evening.
Good evening, Doctor. Please share the screen, Doctor. Hello, Dr. Saylee. Hello, Dr. Saylee Kathane, are you there?
Hello. Hello.
Hello, doctor.
Good
Please share
evening,
the
sir.
screen, doctor. Good
Yeah,
evening,
yeah.
doctor.
Yes, I'm sharing.
Your screen is visible, doctor. Please start the session.
Yeah. Good evening, everyone. Myself, Dr. Saylee Kathane, from CRC Nigri, Pune, studying PG Rashastran by Shiji Kalpana. My today's topic is Triphala, the Ayurvedic approach to your skin problems. Now let's begin with the introduction. Triphala formulation of three fruit products is one of the most important Rasayana drugs used in Ayurveda. Several skin care products based on Triphala are available that claims that its protective effect on facial skin. Triphala, a well recognized and highly efficacy, a polyherbal Ayurvedic medicine consisting of roots of the plant. This is Amlika officinalis, Amlika, uh, Terminella valerica, Bibitak, and Terminella jugula haritaki. Formula consists of the fruits, Amlika, or the Indian gooseberry, Bibitak, and haritaki of the three plants generally in equal proportion, and has been used in traditional medicine in India for over 1,000 years, according to the writing of the great physician Charak in the formula in the foundations text of Ayurveda called the Charak Samhita, as well as in other key texts called the Shushruta Samhita. Now let's see the methodology. Triphala is commonly used and consumed in the form of churna or powder, and it is easily available in the Indian market. You can also make this powder in your home by taking amla, vivita, and haritaki in 3:2:1 ratio, dehydrating them, and making the churna into the mixture. This powder can be stored 1 to 2 months if kept in airtight container. Now let's see its uses and applications. It can be used as a face wash. Use Triphala as your daily face wash. By making a paste with Triphala powder and water, gently massage your face with it twice a day. Make sure to rinse it thoroughly after it dries off and avoid applying it around your eyes. You can also use it for acne. Use Triphala by making a thick paste with 2 tablespoons of Triphala churna, 1 cup of chickpea flour, 1 tablespoon of neem powder, 2 tablespoons of hibiscus powder, 2 tablespoons of brown ghee and honey. Rub this paste on your acne spots. Leave it for 30 minutes. Take a soft and clean piece of cloth, tap it with some lukewarm water, and clean the paste from your face. It can also use for pigmentation. Mix 2 tablespoons of Triphala powder with sesame oil if you have white dominant skin, rose water if you have thicker dominant skin, and just water if you have upper dominant skin. Apply the mixture on the face and leave it for 15 to 30 minutes. Wash it with some lukewarm water after it dries. It is also best used for hairs and also eyes. Observation and result. This update on Triphala gives a clear picture that it has good effect on your skin problems and also hairs and eyes. Thank you.
Thank you, doctor.
Thank you.
Next, I invite Dr. Ashna Radish for the paper presentation. Dr. Ashna Radish, are you there?
Yes, doctor. Good evening.
Good
Is
evening,
it audible,
doctor.
doctor?
Audible, doctor. You are audible.
Okay,
The
shall I
topic
try
of presentation
sharing?
is Panchakosha theory and Grahani. Please, doctor, please share the screen.
Okay. Hello, sir. Is it possible to share from there, sir? I'm not able to. Don't know why.
Don't worry, doctor. I will help you, doctor. I will share for you.
Okay, sir. Thank you.
Doctor, please start the session, doctor.
Okay. Thank you, doctor. Thank you so much. Good evening, everyone. Myself, Dr. Rashna from Department of Shalyatantra, Munyal Institute of Ayurveda Medical Sciences, Manipal. I'm here to present the topic Panchakosha theory and Grahani. Next slide, sir. We all know that Grahani is the seat of Agni, and it is when deranged, it causes several gastrointestinal tract related disorders. And one among them is irritable bowel syndrome. It is a functional disorder because no structural, biochemical, or infectious etiology has been found, and it is a disorder of motor and sensory functions of GIT. There is a strong association of psychiatric disorders in 95% of IBS patients, pointing to the role of psychological factor in the etiology of IBS. Evidence also supports an important role of stress in IBS patients, and it particularly alters the gut-brain interactions. The most holistic concept of human existence, the Panchakosha theory, which is explained in Taittiriya Upanishad, it is no way contradictory to the modern system of approach. And yoga is the best way to bring a balance for these 5 koshas. Yoga and Ayurveda, which is an ancient Indian science, recognized the symbiotic relationship of body and mind long ago, postulated the concept of Adi and Vyadi. The Adija Vyadi, it is explained in Yoga Vasishta. That is, if we consider that different types of emotions may enter into our mind and it affects the Manomaya Kosha. So the first thing that causes problem is in the Pranamaya Kosha. That is, we can understand that if at all we have a emotion or mental distress, our breathing will be disturbed. So the Pranamaya Kosha disturbed, which in turn disturbs the Samana Vayu and Apana Vayu. The disturbances in Prana Vayu also causes imbalance in the autonomic nervous system, which causes problems in the bowel motility and bowel contractility. This causes Atijirnatva, Ajirnatva, and Kujirnatva. Then disturbances in Apana Vata also causes abdominal pain, bloating, and discomfort, which are the main symptoms of irritable bowel syndrome. So this can be considered as Adija Vyadi. That is, Adi is causing a Vyadi, and it is already explained in our Shastra. Next slide, sir. Emotions and gastritis. In research, it was found that emotions like anger, fear, tension, etc. can influence not only the quality and quantity of acid secretion, but also the blood flow and motility of intestine. When we are emotionally excited, we all know that whenever there is an emotion in our mind, for example, if at all we are going to attend any exam, the first thing we find will be we'll have a emotion, we have a sensation of passing motions, isn't it? So it triggers the intense activity of the limbic area. From here, information is passed to the hypothalamus, which is considered as the controller of stress orchestra. Then it passes to the autonomic nervous system and causes different bowel-related irritability. GIT is the first target where stress manifests. Physical complaints are at the level of Annamaya Kosha. All the psychological phenomena are happening in the Manomaya Kosha, as explained in the previous slide. And this is happening because there is no chitta vritti nirodha. That is, our mind is very much disturbed and a lot of emotions are coming and going out of the mind. So the only thing that we can do in order to overcome this state is controlling of the prana. And that is attained through the practice of yoga. The yoga, by the definition, it is told as chitta vritti nirodha. So by practicing yoga, we can find a very best remedy for overcoming IBS-like conditions, which can be correlated to Grahani. Next slide, sir. So getting into Annamaya Kosha, it represents the anatomy, that is the conglomeration of the subtle particles, which is forming the organized system. It is nurtured by nutrients and the food we eat. The only thing that differentiates a man and a human is the buddhi. By this sloka, we can understand that ahara, nidra, bhaya, and maituna are all same for an animal and a human being. It is the buddhi which causes a differentiation between an animal and a human being. The first step is to come out of the superadded fears and phobias. That is, if at all we come to an understanding that it is our lifestyle that is causing problem, it is our personality disorders that is causing problem, that can be attained by the effect of buddhi only. So we have to come into understanding that there should be expressions rather than suppressions, acceptance in place of criticizing, and appreciation in place of jealousy. All these will help us change our inner self and inner personality. And along with that, deep relaxation also can bring GIT related can also bring a balance in GIT related conditions. Another important thing that can be practiced is yogic dieting, in which sattvic food can be included in our diet, and avoiding all the rajasic and tamasic foods such as very sour and salty, very overcooked and uncooked foods. Then also following fasting once or twice in a month is very much important for maintaining the balance in our gastrointestinal tract. Then other yoga kriyas such as Vamana Dauti, Vastra Dauti, Nauli, Udyana Bandha, and Agnisara can help in balancing the Annamaya Kosha. Next slide, sir. The Pranamaya Kosha, as we have seen in the previous slide, breathing is the first thing that we can see which is getting disturbed. So it is a prana that is considered as a life source, and it supports each and every cell in our body. In the previous slide, in the Adija Vyadhi concept, we have seen that when there is disturbances in prana, the Samana Vata, Udana Vata, and Apana Vata gets disturbed. So it is also understood that stress occurs in the Manomaya Kosha. So we have to first keep our prana into our control, and pranayama is the best way to reach to that level. So we can practice pranayama without kumbhaka, then Nadi Shodhana pranayama in Vajrasana soon after the meal, which reduces gas formation, Brahmari, which is to be done in Viparita Karani, sectional breathing, and deep relaxation technique. Next slide, sir. The third layer is the Manomaya Kosha. This is the main important kosha where all the emotions are coming and going. So we have to bring about chitta vritti nirodha, and that can be attained through meditation. Emotional management is taken up by taking special training in Bhakti Yoga, which is featured by surrendering to the divine. Hence, we experience inner freedom and bliss. Acceptance as decision of the universal intelligence or prasad of the Lord is the main feature when we are going through the Bhakti Yoga. It will soothe our nerves, reduces all overreactions of the brain and nervous system, and bring about balance, gives mastery over bad habits, and lead to complete freedom from all imbalances. Another another practice that we can do to balance the Manomaya Kosha is Dharana and Samadhi, which are two main important factors of Ashtanga Yoga. We can also focus and defocus of energy in the navel region to diffuse the prana and achieve balance. Next slide, sir. The fourth and the fifth koshas are Vijnanamaya Kosha and Anandamaya Kosha. Vijnanamaya Kosha, it is attained when once the mind is calm. That is through meditation. If at all our mind is calm, at that time only our logic starts to work, and we can take in very good decisions whenever we are in distress. So it is very important to keep Vijnanamaya Kosha in a balanced way. The last one is the Anandamaya Kosha, which is considered as balance of all sense organs. It is the act of learning of being happy in all times. It is very not at all good in awaiting for the future happiness or thinking about the past, whichever already has happened. It will only create stress, and it causes anxiety and worries, resulting in problems like indigestion. Next slide, sir. Another important aspect that we can take into consideration is the Manipura chakra, which is the third chakra in Shat chakra theory. It is also called as energy center or the solar plexus. The color of the chakra is yellow and the root mantra is Ram. If at all we are focusing on this area and we are chanting the root mantra Ram, it slowly helps in calming down the mind as well as calming down the digestive processes and metabolism. It can be considered as part of autonomic nervous system. It is said to govern the digestion and metabolism and also known as a seat of Agni. Manipura chakra is also related to endocrine system. It is located at the back of the stomach or upper abdomen, where the celiac trunk is divided into renal arteries and other arteries. So imbalance and blockage of solar plexus can lead to stress accumulation, and also it shows physical manifestations. So practicing of yoga, pranayama, positive affirmations, and aromatherapy can be helpful in balancing the Manipura chakra. Next slide, sir. Now we'll see some of the yogic postures which can help in balancing the Agni and balancing the gastrointestinal tract related disorders. First, we have to go with the Shitalikarana Vyayama. Then postures in standing postures such as Ardha Kadi Chakrasana, Ardha Chakrasana, Padahastasana, sitting postures such as Paschimottanasana, Vajrasana, Vakrasana, Gomugasana, supine postures such as Sarvangasana, Halasana, Viparita Karani, and prone positions such as Bhujangasana, Dhanurasana, Shalabhasana, etc. can be well practiced, and it can help in balancing of the body. Pranayamas such as Nadi Shuddhi Pranayama, Bastrika, Shitkari, Shitali will also bring calmness to the body and calmness to the mind. The other Shat Kriyas such as Agnisara, Nauli, Basti, Kapalbhati, Udyana Bandha, along with deep relaxation technique can be practiced, which in turn brings balance of the body and balance of the mind. Next slide, sir. Coming to discussion and conclusion, researchers emphasize that yoga can make one feel more connected to their bodies, especially both the internal and the external organs, and it promotes a positive body experience and sense of well-being. The 4 components in wrong lifestyle are diet, lack of exercise, habits, and emotional stress. If the root cause is corrected, health can be restored. So in the previous slide, we have seen that yoga can be made well used in order to bring a balance in body as well as mind. Our mission is to involve techniques to unfold the inner potential divinity of a man towards better and positive health. Yoga modality is envisioned from the cost effectiveness in managing IBS and its related comorbidities like anxiety, depression, and fatigue. Thank you all. Thank you for listening. Thank you.
Thank you, Dr. Ashna. Next, I invite Dr. Milana MN for the paper presentation on the topic Vishwaji. Dr. Milana, are you there? Hello, Dr. Milana, are you there?
Hello, sir.
Okay,
Can you
doctor,
hear me?
please. Yes, doctor. Please share the screen, doctor.
Hello, sir. Can you share the screen for me?
Okay, 1 second, doctor. I will share for you. Doctor, please start the session, doctor.
Good evening, everyone. Myself, Dr. Milana, third year PG scholar, Department of Panchakarma, from Munyal Institute of Ayurveda Medical Sciences, Manipal. Today, I'm here to discuss few things about Vishwaji. In present day lifestyle, there is more increase in the incidence of Vata Vyadis, amongst which Vishwaji is having a leading share due to its prevalence in working class and in elderly. Hence, today I'm going to focus on this burning issue. Next share. Vishwaji is one among the Shula Pradhana Vataja Nanatmaja Vyadis told by Acharya Bhava Mishra. And in Shabda Kalpadruma, the meaning of Vishwaji is given as Vishwa is the entire or whole thing, and also Dhatu. Anj means directed towards or to move or to wander about. Also, it also means that paralysis of the arm. Thus, it literally means to spread out, to spread throughout. Next slide, please. There are various references of Vishwachi told by our various acharyas by Sushruta, Charaka, Vagbhata, Chakradatta, Sharangadhara, Madhava Nidana, Bhava Prakasha. Next slide, please. Nidhanas of Vishwachi includes Aharaja Nidanas like Ruksha, Shita, Lagu, Alpa, Ahara, etc. And Viharaja Nidanas include Langhana, Plavana, Ati Adva, Ati Vyayama, Diva Swapna, etc. And Dukkashaya and Asana. This is most usual present-day causative factor. And Abhigata and Dhatukshaya also leads to Vishwachi. Manasika Nidanas like Chinta, Shoka, Ragha, Baya, Krodha, etc. Rajogunas, all these Nidanas, next slide. All these Nidanas leads to Vata Prakopa. And Vata Prakopa, it moves all over the body and gets settled wherever the Kha Vaigunya is present. In this condition, Kha Vaigunya will be present in Griva Pradesha, where Vata fills up the Srotas and does Shoshana of Shleshaka Kapha present there, that is in Griva Kashyarika Sandhi, and causing its Vikara, and in turn leads to Dushti of Kandaras of Bahu and leading to Vishwachi. Next slide, please. Sushruta has described it as Talam Pratyangulinam tu Kandara Bahu Prishtayoho Bahu Karmakshayakari Vishwachihi Saspruta. Due to aggravation of that Vata, it does the Visheshan of Kandaras of Bahu, Prushta, Tala and Pratyanguli, leading to Bahu Karmakshayakari. That is the loss of function of both the arms. Next slide, please. Samprapti Ghataka includes dosha, the main dosha involved in Vishwachi is Vata, and Dhushya is Kandara of Bahu, Srota Dushti is due to Sangha, Adhisthana is Griva, and Vektasthana is Bahu, Tala and Pratyanguli. Next slide, please. Avarana, here we can consider as it involves Griva Kashyarika Sandhi, Asti Majjavrita Vata can be taken as Avarana. Rogamarga is Madhyama Rogamarga, has Sandhi is involved, and Vadhi Swabhava is Chirakari. It takes long duration for its treatment. Many acharyas have mentioned only one lakshanas, like Sushruta, Vagbhata and Madhavakara have told that as Bahu Karmakshaya or Cheshtapaharana, loss of function of the one of the arm or both the arms, and Dandana says that it resembles Gridrasi, but it affects Bahu. Gayadasa, Arunadatta and Vijaya Rakshita has explained only one symptom of Shula. Next slide, please. The differential diagnosis will be based on the presenting signs and symptoms. One of the differential diagnosis is Apabahaka. Bahu Praspanditaharam Shula Stamba Amsamula Stito Vayu Shosha Itwamsa Bandhana. Vagbhata told it as due to aggravation of Amsamula Stita Vayu, it causes Bahu Praspandanahara, that is movement of the arm, and Shula, Stamba, and Shoshana of that Sandhi, and Amsa Bandhana. Amsa Bandhana is stiffness. Pain does not the pain does not radiate as that of Vishwachi. It is more or less restricted to Amsa Pradesha. Amsa Shosha. Asti Sandhi Daurbalya. In this condition, only Asti Sandhi Daurbalya will be there, and Mamsakshaya or Shosha will be present in this. Amsa Shosha is purely ruled out as pain is completely absent, along with signs of atrophy. Next slide. Manya Stamba. Stamba of here it presents with Stamba of Griva and Amsa Pradesha. Manya Stambam Prakurute sa eva Shleshmana Avritaha. Due to Shleshmana Avrita, there will be Stambana of Manya Pradesha leading to Dantanam Dashanam, Lala Srava, Jrumba, Vadana Sangha. Manya Stamba main site will be neck. Other symptoms like Vadana Sangha are completely different from that of Vishwachi. Next slide. Ekanga Roga. It is ruled out based on the absence of Sankocha, which might be indicator of atrophy or contracture. Sankochayati, here we can take it as contracture. Sankochayati ekam hastam. one of the hasta is contracted, and due to avarana of sira and snayu by vata, it may lead to toda, shula, and shoshan of the involved hasta. Next slide. Chikitsa. Almost all the acharyas have mentioned the similar chikitsa. Charaka is told as Bahya Abhyantaratah Snehaihi Asti Majjagatam Chayet. As I told before, this is Asti Majjavrata Vata. Here Bahya and Abhyantara Sneha can be used for treatment. Bahu Shirshagate Nasyam Panam Chodtarabhasteha. In Bahu and Shirshagata Rogas, Charaka is told Nasya and Uttarabhaktika Pana can be helpful. According to Vagbata, Dashamula Bala Masha Kwatam Tailajya Mishritam Sayam Bhutva Piben Nasya Vishwachi Avapahuki. Vagbata told Dashamula Bala and Bala Masha Kashaya added with Taila and Ajya can be given for Pana, and this Kashaya can also be used for Nasya in case of Vishwachi and Avabhaka. He also told that Siravyata can also be done in case of Vishwachi. Arunadatta has told that Siraveda can be done in Hasta, about 4 angula above the Hasta. He has told the site of the Siraveda. Next slide. Chakradatta has told the Chikitsa Sutra as follows. Vakshastrikas skandagatam vayam manyagatam tatha vamanam hanti nasya cha kushalena prayojitam. In case of Vaksha, Trika and Skandagata Vata, and in case of Manyagata Vata also, Vamana and Nasya helps in a very useful way. And Nasya with the help of Dashamulyadi Vata is told by Chakradatta. And he also mentioned about Siravyata. Sharakadara told Gunjalepa will be useful in case of Vishwachi. Next slide. So Shruta has told about only Siravyada in case of Vishwachi. For the diseases like Rudrasi, Vishwachi, etc., Vataja conditions, he mentioned Siravyada as one of the important treatment factor. And he also told that Samanya Vata Vyadhi Chikitsa can be used for the treatment. Next slide. Samanya Vata Vyadhi Chikitsa can be taken as Snehana, Svedana, Nasya, Lepa, Seka, and Vatahara Aushadas, Ahara, and Vihara. Snehana includes both Abhyantara and Bahya. In Abhyantara Sneha, for Abhyantara Sneha, Vagbata has told Chatusneha and Mahakalyanaka Gruta can be used for Abhyantara Sneha in case of Vishwachi. Charaka has told Uttarabhaktika Snehapana with the help of Masha Saindhava Sadhita Taila in case of Bahu Shirshagata Vata, as I told it before. Next slide, please. In case of Bahya Snehana, Abhyanga can be taken one of the main treatment. Abhyanga does the Snehana effect to Sandhi, Sira, Snayu, and Kandaras, etc. of the particular part. It does Brahmana and Vatahara action. And for Abhyanga purpose, we can use Mahamasha Taila, Garpa Sastyadi Taila, Kshira Bala Taila, etc. Next slide. In case of Sneha, there are 3 types of Sneha, as everybody knows: Ruksha Sweda, Snigdha Ruksha, and Snigdha Sweda. In case of Samavastha and in acute conditions, Parisheka can be taken as an option. And in case of Nirama Avastha, Snigdha Ruksha Sweda, that is Patrapinda Sweda, will be useful. And in case of Pravruddha Vata or in Dhatuksha or in chronic conditions, Snigdha Sweda can be used. For example, Shashtika Shalipinda Sweda can be used. Next step. For Nasya, Dashamuladi Kwata Nasya told by Chakradatta and Vagbhata, Masha Saindhava Sadhita Taila told by Charaka, and Anutaila Nasya can be used. And it does the Brahmana, and mainly it acts as it mainly acts on Gutva Chatra Vikaras. It does Brahmana and Snehana effect of the local Sandhis, Siras, Nayu, Asti, and Kandaras. Next slide. And the Nasya's mode of action will be, as we put a Snehadravya, it reaches the Shrungataka Marma and which spreads locally in the Murdha, and it reaches the junction of Shrotra and Kantha, and Siramukas, and does its action by reducing the local symptoms in case of Vishwaji. Next slide. Lepa. Vatahara lepa having Brahmana and Ushna guna can be used for this purpose. As Sharangadhara told, Gunja lepa can be used, Sthiradi lepa can be used, Poladi pradeha, Pola Kulattadi pradeha can be used for this purpose. Treatment will be based on Samprapti and Lakshana Sambandha. So based on the treatment, based on this, treatment will be planned primarily. Samanya Vatavyadi Chikitsa will be applied, and based on special cases, these other line of treatments will be applied. Next slide. Seka. Seka is one of the Seka with the Vatahara Kashayas and also with the help of Thaila. It can be done. It acts similar to Abhyanga. Its action is similar to Abhyanga. Next slide. As it presents with Karmakshaya, Ubahu, Shula, or Balakshaya, similarly in the contemporary science, it is similar to that of brachial neuritis, which presents with two major symptoms of pain radiating from neck and weakness of one or both the arms. This looks similar to that of Vishwaji, so I correlated it to the brachial neuritis. Thank you, everyone.
Thank you, doctor. Let's invite Dr. Rohini Ramesh Arsul for the paper presentation. Dr. Rohini, are you there? Dr. Rohini Ramesh, are you there? Dr. Rohini Ramesh Arsul, are you there? Okay, next I invite Dr. Madhuri Shivaji Tope for the paper presentation. Dr. Madhuri, are you there?
Yes, I'm there, sir. Am I audible?
Okay. Audible, doctor. Please share the
Okay,
screen,
okay.
doctor.
Yes, sure. Sir, screen is big green, sir.
Your screen is visible,
Hello.
doctor.
Okay, okay. Will I start now?
Sure, doctor. Please start.
Good evening, ma'am. Good evening, everyone. I'm Dr. Madhuri Tope from SVNST Ayurved College, Rahuri, Ahmednagar. I am third year PG pursuing student in Prasuti Tantra and Stri Rog department. Today, I'm going to present a small paper presentation on the topic clinical efficacy of Sir Charadi Teila Basti in management of PCOS. Today's my topic is it is a case study based on PCOS. So let's get started. Title name is Clinical Efficacy of Sir Charadi Teila Basti in management of PCOS. Before starting with the introduction, we'll go through abstract in short. Menstrual irregularity, acne, obesity are the most common reproductive health problem that adolescent girls are facing in present era. The most debilitating underlying disorder that causes this problem is polycystic ovarian syndrome. Initially, PCOS was related to infertility only, but now it is clearly established that in many, it starts with the puberty and ends with the menopause. The associated endocrine and metabolic abnormalities with PCOS plays an important role in causing not only infertility but also put a woman at the high increased risk of type 2 diabetes, chronic heart disease, dyslipidemia, hypertension, hyperinsulinemia, and obesity. For the paper presentation, I have presented a small case study, a single case study. A 19-year-old female patient approached the OPD complaining of irregular menses, acne, obesity, hair fall, weakness. This all complaints. She came with this all complaints. The UHG abdomen scan revealed a PCOS. Patient took a lot of allopathic treatment for it, but did not get relief. So she wanted to take a Ayurvedic treatment. Hence, she was treated as per the Ayurvedic baseline of treatment of Artha Vyapat. She was administered Sahacharadi Tel Basti for 7 days along with the Chandraprabha Vati and Arogyavardhini Vati internally. After such 2 cycles of the Basti Chikitsa for next month, menses were regular. In follow-up, after 6 months, all the symptoms were subside and the scan revealed absence of the PCOS. During this treatment, patient did not report any negative effects, suggesting progression of the disease. An attempt has been made for successful management of PCOS in the adolescent age to relieve her symptoms. Introduction. The incidence of the delay period, oligomenorrhea, acne, etc., in the adolescent girls and the young women is rising in our practice. These women do not ovulate regularly, and the ovaries show small multiple folliculi looking cyst, hence called polycystic ovarian disease. PCOD is a common cause of infrequent and irregular period, affecting as many as 10% of the women in our reproductive age. The PCOD is a familial condition and appears to have its origin during adolescence, mainly associated with the increased weight gain during the puberty. In Ayurveda, there is no direct mentioning of this disease, but the symptoms of the PCOD is found under various disease condition at various reference, that is menstrual irregularity, as described under the broad heading of the Ashtartavadushti. Case report. As I said, for this paper presentation, I have done a single case study, and I'm going to present you here. The case, this is the case report of that single case study. A 19-year-old unmarried female came to the OPD of the Stri Rog and Prasuti Tantra department at SVNST Ayurved College with the complaints of irregular menses since 2 to 3 years. She was taking allopathic treatment last 2 years, 2.5 years, but did not get complete results from it. Her other complaints were as follows: irregular menses since 2 to 3 years, acne since 1 year, weight gain since 1 year, hair fall since 6 months, mood swings, generalized weakness. All these signs and symptoms are related to the PCOD. The past history, no DM, HTN, and other comorbidities. Family history, there were no major family history. Occupation, she was a student. Menstrual and ops history, 3 to 4 pads. She was near 3 to 4 pads over 45 to 60 days. Irregular, it was sometime it was 1 month, 2 months. So it is mentioned 45 to 60 days. Irregular cycles. The flow was moderate and dysmenorrhea. Clots, during the flow there were clots. Menstrual marital status, unmarried she was. Diet, irregular timing, junk food, Chinese foods she used to have. Sleep was disturbed. Physiological upset, disturbed, stress, anxious, irritable. General examination was done, that was absolutely normal. The weight was increased. According to her height, the weight was more. Systemic examination was done, and it was normal. Physical examination revealed obesity. Laboratory investigations were done. Routine blood investigation were done. Thyroid function test was assessed, and UHG abdomen pelvis was done to know the condition of the uterus and the ovary. Report says polycystic ovaries. Diagnosis was done according to the Ayurvedic base, Artha Vyapat. Therapeutic intervention based on the Ayurvedic line of treatment of Artha Vyapat formulated a line of treatment. Abhyantara Chikitsa was also given along with the Basti. Abhyantara Chikitsa was given, that Chandraprabha Vati was given 250 mg twice a day. Arogyavardhini 250 mg twice a day with the lukewarm water. Duration for Basti was 7 days. Duration was 7 days prior to the Basti. Patient was admitted in SVNST Ayurved College, Rahuri. Panchakarma, patient was given 2 setting of Anuvasam Basti with the Sarcharadhi tail for 7 days. Purva Karma, Sarvanga Snehan Swedan was done. Bashpa Swed was given before the Basti. Anuvasam Basti Karma is given in the 2 cycles. Interval between the 2 cycles was 15 days. The order of the Basti is as follows. The A means Anuvasam Basti with Sarcharadhi tail from first, second, third, fourth, fifth, and sixth, 7th day. Complete 7 days, the Anuvasam Basti was given to her with, as I said, with internal medicine, Arogyavardhini and Chandraprabha Vati. The observation was made. Observation I have mentioned in this table form. Changes occurred in the subjective and objective criteria before. After completion of the first cycle of the basti, and after completion after second basti was observed, and they are mentioned as follows. Criteria, I have made a criteria. Menses before treatment it was irregular. Before treatment it was irregular. After first cycle it was regular. Second cycle it was regular. Acne was before the treatment. The acne was she had a acne on her face, but after the first cycle of the basti, her acne reduced, and the second cycle the acne was vanished. Uterus was bulky. After first cycle it came to be normal, and second cycle normal. Weight gain was 55. Her weight gain was 55. As the first cycle basti was done, it came to 53. Then later on 49. Hair fall before it was present, then it will gradually reduce. Mood swings were reduced. Generalized weakness was completely. She had a relief. USG abdomen and pelvis was done on before treatment and after treatment. Regular follow-up was done for general condition, menstrual cycles, and other changes in the body and mind. Important follow-up diagnosis and other test result. After the treatment, when there was a regular menstruation, decreased body weight, mentally active was observed. Patient was referred to get a USG and a USG of abdomen and pelvis study done on its clear. That there was no PCOD. Ovaries were normal in size. We have given a Sarcharadhi tail basti for 7 days. Now I will let you know what is the action what is the probable mode of the action of the Sarcharadhi tail basti. The main objective of the treatment is to regulate the menstrual cycle and the proper flow of the artha during each menstrual cycle. Moolastan of the artha srotas is Garbhashaya and Artha Vahini Dhamani, which is the main seat of the Apan Vayu. In this disease condition, mainly Apan Vayu Drishti is there, and Basti is the most effective treatment on this. So for this patient, we choose Basti treatment as a Vatar Chikisa. If we do only Lekhan and Bhedan, if we do Lekhan and Bhedan treatment, it may lead to the Vata Vruddhi. So for that purpose, treatment using Snehan is the more effective. So we give Sarcharadhi Tel Anuvasam Basti in the patient. Sarcharadhi Tel Basti contains 4 parts, Tila Tel and 16 part cloth of the Sarchar Devdaru Nagara. What Devdaru is a Kapha and Vata Shamak property. Nagar it is Kapha and Vata Shamak same, and Shotahar Shulahar same. Kapha Vata Shamak having the property of Vedana Stapan Shotahar. Sarsaradhi tail, which is mentioned by the Vagpat, contains the 3 drugs, among them all having the same Ushna Virya and a Kapha Vata Shamak property. According to the Charak, Acharya Charak, Sarsaradhi tail basti is the Sarvanga Shamak Rasayan useful in the Vata Shamak Pitta Vikara Rupa Varna Bala Mansa Shukra Vardhan. In this disease condition, it is useful as Rasayan Bala Man, Shukra, Vardak, and Vata Shamak. Searcher is used to remove unwanted follicles. Oil of the searcher was helped to destroy the cyst of an ovary and stimulate the follicular maturation. Conclusion. Conclusion of the given treatment was using Ayurvedic basic principles of the dosha, dushya, dhatu, srotas, sthana, dushti. Any disease can be diagnosed and treated as well. In the above mentioned case of the Ayurveda, treatment help in improving ovarian function as well in combating hormonal imbalance and regulating the normal menstrual cycle. So it can be concluded that the Ayurveda can not only help in relieving the symptoms, but also treatment can be done successfully applied in the PCOD and the infertility in today's era for the better outcome and with no side effects. Along with this, Panchakarma Chikitsa internal medicine is also important. These are the reference from where the study has been done on PCOD. Thank you, sir. I have done with my presentation.
Thank you, Dr. Madhuri.
Yes. Thank you.
Let's say invite Dr. Manasi for the paper presentation on the topic role of Panchakarma in preventive health. Dr. Manasi, are you there?
Yes, sir.
Okay, Doctor, please share the screen, Doctor. Your screen is visible, Doctor. Please start the session. Dr. Mansi, please unmute, doctor. You are in mute. Please unmute, doctor. Hello, Dr. Mansi, you are in mute, doctor. We can't hear your voice, doctor. Please unmute, doctor. Hello, Dr. Mansi, can you hear me?
Hello, sir. Sorry. Sorry,
Okay,
sir.
doctor.
Yeah.
Once again, please share the screen, doctor.
Yes, I'm sharing, sir.
Okay, now it's okay, doctor. Please continue, doctor.
Yes, sir. Hello, everyone. I'm Dr. Mansi Vaidya from CRC Nigri, Pune. I am from Kriya department. Hello, sir. Am I audible?
Yes, doctor. Audible, doctor.
Yeah. My topic is role of Panchakarma as a preventive health. Introduction. Health is a state of homeostasis of the body, doshas, agnis, dhatus, and removal of waste products and toxins properly. In stressful and polluted environment, our body and mind accumulate toxins causing various diseases. For this condition, Panchakarma plays a vital role in expelling out the toxins from our body in a proper way. Panchakarma is one of the weapons of preventive health management. Material and methods for this study is data collected from various classic texts of Ayurveda and Yoga, Charak Samhita, Ashtang Hridayam, Shushruta Samhita, and various research articles. Purpose of the study: aim to review the preventive role of Panchakarma as in preventive health. An objective of this study is to study Ayurvedic principle, that is Panchakarma, as a preventive role. Preparatory procedure, that is Purva Karma, that includes Snehan and Svedana. Snehan is one of the most important therapies that prepares the body to receive specialized Panchakarma treatment. It involves the application of medicated oils, ghee, herbs to the body internally as well as externally for 3 to 7 days. Snehana is a crucial as it loosens the arm toxins, doshas in body. Svedana, next one is the word Svedana is derived from Sanskrit word. The meaning is to sweat or the perspire. The Svedana helps in relieving stiffness, cold, heaviness in the body and produces sweat. Svedana is also referred to the internal excreta of the body. Swedan karma in Ayurveda is instrumental in helping to liquefy the sticky and adherent doshas that have locked in that peripheral tissue. Panchakarma, that includes, first one is Vamana, the process of medical emesis. The benefits of Vamana is the prevents respiratory tract disorders like allergic rhinitis, prevents skin issues, psoriasis, effective in diabetes, effective in Kapha condition like thyroid abnormalities, dyslipidemia, reduces harm in body, improves digestion and metabolism, significant improvement in physical and mental health, clean ups, channels, and maintaining balance in three doshas. Next one is Virechana, that is purgation with medicated ghee, oil, and medicines. And benefits of Virechana will be improves digestion and metabolism, helps in minimizing skin issues like rashes, allergic reactions. It is helpful in reducing pitta-related conditions like piles, ulcers, poisoning, acidity, etc. It is also helpful in asthmatic condition, that is Shwasa Vyadhi, effective in paralytic condition, and useful in heart related condition. effective in treatment in obesity also. Next one is Nasya. This is nasal treatment in the form of medicated powders, nasal oil, ghrita, or medicated juice. The benefits of Nasya is develops and strengthens shoulder, chest, skin, and neck, that is Urdhva Jatravad, and the sensory organs become much stronger after Nasya therapy of 3 to 4 weeks. For any person witnessing gray hair, Nasya treatment prevents further damage with regular treatment. The nasal medication also strengthens the visual sight of a person, acts as a preventive measure. Next one is Basti, that is medicated enema. The benefits are relieves chronic constipation, effective in infertility treatment, helpful in lumbago, and effective in relieving pain in cervical spondylosis, lumbar spondylosis, effective in Vata Vyadhi, helpful in neurological disorders, effective in osteoarthritis and rheumatoid arthritis also, effective in obesity treatment. The last one is Raktamokshana, that in bloodletting, and benefits of this Raktamokshana will be preventive for many skin problems like acne, eczema, psoriasis, gives protection to liver, spleen health, effective in osteoarthritis, rheumatoid arthritis, frozen shoulder, also useful in diabetic wound, non-healing ulcers, effective in varicose veins. It prevents further complication in abscess, tumors, useful in hypertension, and effective in alopecia. The result of this study is detoxification of body and removal of accumulated toxins, restoration of balance and harmony in the body and mind, strengthening of the immune system, enhancement of overall health and well-being. Conclusion of this study is the regular Panchakarma treatment as a preventive health practice, use of Panchakarma as a tool to identify and address the imbalance before they manifest as a disease, and incorporation of Ayurvedic principles into daily life to promote preventive health. Thank you. Thank you, everyone.
Thank you, Doctor. So next I invite Dr. Shilpa.
Yes.
Present paper and poster presentation.
Yes, sir. Please pardon. Shall I share my screen?
Sure, doctor. Now please share the screen. The screen is visible, doctor. Please start the session.
Yeah. Okay, sir. Thank you very much. Myself, Dr. Shilpa Yarmin from SJR College, Solapur, Maharashtra. And my today's topic of presentation is menopausal syndrome, Ayurveda way. As we know that woman undergoes various stages of life. But unfortunately, in our country, there is no such awareness programs conducted. But I think nowadays there are, in some hospitals, there are clinics which are specially meant for menopause program. So in my today's presentation, I'm just throwing light on the Ayurveda menopause view, as all the human beings and all the like girls, all the women and men, they have to go through the 3 stages of life: childhood, adulthood, and elderhood, and brahmacharya, grihastha, and sannyasa. And traditionally has been viewed as a period of letting go of the need to achieve. And menopause is also a time to like it is a cessation of the menstrual flow, which start at the age of 12 around, and which cessate or which stops around the age of 50. There are various stages of menopause. The first one is premenopause. Next one is perimenopause, and the lastly permanent cessation of period is called as menopause. It is almost around 50 or 55 at the age. So during menopause, as there are main 2 hormones, female hormones, estrogen and progesterone. These are 2 powerful female hormones. They drop down, and since hormones serve the vital pitta and kapha function, it is very important that these 2 doshas specifically are balanced at a very healthy level when entering into a menopause. So menopause is though it is a vata phase of life, but it is a pitta also. So we are in the pitta and vata phase. So one woman has to balance the Pitta and Vata dosha. Pitta should primarily reside in its home in the core, providing a solid source of Agni. Kapha should not be depleted as it nourishes all the tissues so that they are not whisked away with the littlest change. During menopause, we are low on ojas, and so we have a lesser ability to maintain the balance even in same environment and with the same stresses. Couple that with the erratic nature of Vata, and when unchecked, our body shifts into sympathetic overdrive. Our nervous system is the delicate balance of the sympathetic nervous system, a stress-oriented system that exists for self-preservation, and the parasympathetic nervous system, which functions to relax and renew. These two branches work as opposing yet complementary systems. Because of low ojas, menopause becomes a state of high sympathetic nervous system, cortisol levels increases, blood pressure increases, heart rate increases, and this state of stress drives high pitta throughout the body, ready to attack any threat. Further, this with the cessation of the monthly blood release, the menstrual cycle can be seen as a therapeutic rakta moksha, and this is therapy used in traditional panchakarma where blood is let down for the purpose of relaxing excess pitta. So kapha, which governs the growth factor, pitta transition phase, and vata is like it is a factor of degeneration. The heat traveling in the circulatory system give rise to hot flashes, troubled sleep, and in an extreme case, heart disease. High vata also flows downward, drying out the vagina. High vata in the colon and other deeper tissues causes the dryness. In an extreme case, it can lead to conditions such as osteoporosis. Superfine teja also decreases, leads to troubles with the memory and the concentration, and the higher predisposition to cancers. Elevated undergrounded vata disperses throughout the body, carrying your core digestive fire, Agni, away from its home in the stomach and intestines. And this leads to difficulty with digestion and overall nutrition. So here are the levels of estrogen during the age, various stages of age. Now, just we have some slides of different dosha menopause, vata menopause. What happens during the vata menopause? Nervousness, anxiety, panic, mood swings, vaginal dryness, loss of skin tone, cold feeling, irregular cycles, insomnia, and constipation, palpitations, abdominal swelling, pain in the body, joint pains. So increasing the amount of hot food. What should one lady do during this vata phase or vata menopause? She should increase the amount of hot food and beverages, regular eating, use of spices such as dill seeds and caraway, reducing the consumption of caffeine and other stimulants such as refined sugar and carbonated beverages, going to bed early, daily massage with almond oil, practicing yoga and meditation, regular exercise and long walks are beneficial for vata type of menopause. Pitta menopause, or if a female is having a pitta prakriti, the main characters are anger, irritability, and hot flashes, angry outburst, irritability, sweating at night, urinary tract infection, skin rashes. Brahmi, Mandukparni, Vangabhasma, Gokshur, and Shvetamusli are the some herbs which are useful for pitta menopause. Increase the cooling products like water, sweet juicy fruits, vegetables, and spices which are having a cold potency like cinnamon, cardamom. Avoid hot spicy foods, hot drinks, alcohol, late night eating, and so these are the some indications for pitta menopause. Kapha menopause, as kapha always like it gives bulk nourishment. So in kapha menopause, weight gain, sleepiness, sluggishness, slow digestion, fluid retention are much more common symptoms. Drugs like Shatapushpa, Jatamansi, Arjuna, Shilajit, Shankapushpi are very much beneficial during the stage. Consumption of light, dry, and warm food, use of more fruits, whole grains, legumes, and vegetables are also beneficial for kapha type of menopause. So make peace with the past, do a monthly cleanse, eat a vata balancing diet, Agni, look for the Agni, balancing Agni, practice pranayama and yoga, and try yoga nidra. These are some useful points to be noted for the normal menopause. Abhanga, Shirodhara, hydration, and Chavanprash and Avala products are also beneficial, or classical formulas for rejuvenation. So now we are having some character-wise or symptom-wise treatment module, or symptom-wise what Ayurveda can suggest. How can we deal with the menopausal syndromes? Mood swings. If a female is having a mood swings, do pranayama, dhyan, concentration practices, move with your hobbies, have a time with your lovely ones. Nasya is very beneficial. Dhatu poshak ahar is also good, and congenital congenital diet is beneficial for mood swings. Dryness is the main problem during the menopause. So for dryness, massage, whatever, like head massage, pada bhinga, shiropichu, katibasti, and spas. For vata, we can use sesame oil. For pitta, coconut, shirbala oil are beneficial. For kapha, mustard oil and sesame oil are beneficial. Diet which is having mostly like milk, ghee, and makhan, madhur diet is beneficial for this dryness. Constipation is also a very much common symptom or character. So for constipation, if it is chronic, diet change, cooking method change, deepan pachan followed by shodhan, and mild laxatives like castor oil, avipatikar churna, gandharavartaki can be used. Insomnia, improving sleep includes sweet, heavy, nourishing, nutriting food that nourish your mind, body, reduce stress, anxiety, and drink milk before bedtime, which will benefit for the nidra, proper nidra or proper sleep. For the insomnia, meditate before the sleep. If a woman having sexual problems, low sexual drive, so Shodhan, Shaman, and Rasayan Chikitsa, Dhatu Pushti Chikitsa, and if high sex drive is there, counseling, concentration practices like yoga, meditation, and sattvic diet, avoid rajasic diet, tamasic food also avoided. Brahmivati, Suvarna Saratva are also beneficial for this symptom. Stress, anxiety, nervousness are also common. Jirakadhyarishta, Balarishta, Brahmivati, Shirodhara, Nasya, Takradhara, Saraswatarishta, Amlakirisana, useful for this. Maintaining bone health. So bone health for, we should take proper daily dose of vitamin D or strive for healthy bowel movement. Ayurveda encourages having bowel movements 1 to 2 times a day. Drink plenty of water to maintain the bone health. Hot flashes, practice cooling pranayama like Shitali, Sitkari, adjust your diet, maintain a healthy weight. Kapha, and for kalpas like Chandanaso, Gulkanda, Mukta Prabhar Pishti are useful for hot flashes. If a woman is having breast tenderness, self breast examination, palpation, self see for lump or secretions, and work on Rasadhatu, Rasapachan. For prefer Guruchu tablet, Avipattikar Churna. If a woman is having UTI infection, recurrent UTI infection, then we should use Varunadi Kashai, Punarnava Kashai, Gokshuradi Vati, and Shadanga Pani, Tranapanchamul Kashai is beneficial. DUB is also much more common symptom. USG scanning, hormone profile should be done, and Ashukarishta, Patrangaso, Pishanuchur are also beneficial. If weight gain is there, rule out the cause, make a routine, Deepan Pachan, classical viration, Basti, Udvartana also beneficial. Anti-aging for Rasayana, Loha Sav, Amlaki Rasayan, Dhatri Loha, Saptamrut Loha, cumin, and fenugreek laddu, groundnut chikki are also beneficial. So a woman which is undergoing the menopause or in the perimenopause condition, she should go with the investigations as per like USG, pap smear, mammography, urine test, hormone profile, and look for the weight gain. So I think this is my message, menopause with a smile. Thank you very much. Sir,
Thank
shall
you,
I
Dr.
share
Shilpa.
my
You will explain the
poster?
level, application level, and for all of us.
Yes, ma'am.
Please share, doctor.
Yeah, this is my poster topic, poster presentation. My topic is health benefits of millets. Millets, sir, ma'am, what is the time for poster presentation? What will be the limit?
Maximum in 88 minutes, ma'am.
Okay, okay, sir. Okay, thank you. So as millets are nowadays everywhere there awareness programs on millets. Millets are known as coarse grain or poor people crops. And in Ayurveda, millets are called or known as Trunadhanya or Kudhanya, which are used in some parts of Asia, Africa, and they use millet as a main food component. It is also used to prepare beverages, bread, porridges, and snack food. Millet is an alkaline forming food and balances the pH of the body. Why one should use millets? As millets are very beneficial, or as they are a nikrushta ahara, and they are the seed which are having a gluten-free cereal. So this gluten-free cereal and its high protein content make it a good energy booster. And they are good source of antioxidant and improve the digestive health, respiratory function, detoxifies the body, improves the immunity, prevents the degenerative diseases like Parkinson's, diabetes, cardiac disease, cancer. And so nowadays people are aware and prefer much more millets. So these are some types of millets like pearl millet, buckwheat millet, barnyard millet, foxtail millet, finger millet, amarnath, these are some varieties of millets. And according to Ayurveda, millets can be used in Kapha Prakopak Vyadhi for Lekhan and for Shodhan purposes, as these millets are having a very much poor nutrition. So we can use various recipes. I have shown some recipes of millets too in this my poster. Some diseases which are very much common in our country, like diabetes. So for diabetes, these millets are also beneficial to promote the healthy blood sugar level. It can be preferred for cardiovascular diseases. Millets reduce the cholesterol level and prevents the cardiovascular diseases. The magnesium content of millet reduces the frequency and effects of migraine and heart attack. Obesity nowadays, I think child obesity is much more common, and in our society, there are many peoples who are suffering from the obesity, and obesity is a leading cause of many diseases or many concerned factors. So vitamin B3 content of millet helps to reduce the cholesterol level and maintain the healthy weight. Millets are also beneficial for celiac diseases, as millets are gluten free and hence used in the patients suffering from the gluten sensitive enteropathy. Cancer is much more common. Between the 10 among 2 people are suffering from cancer. So the phenolics contained in millets help to prevent the risk of cancer. If there is any type of inflammation, we concern it due to the kapha imbalance, and it is due to the santarpan also. So millets are good source of antioxidant and thus stimulate the wound healing, prevents the tissue damage and pre-aging symptoms. Millets also prevents gallstones, gastric ulcers, childhood asthma, and hypothyroidism. Millets are good to keep the obesity under check, which is seen often associated with hypothyroidism. So people with hypothyroidism can use these millets, and millets have lower glycemic index than rice. So millets can help with reducing the chances of diabetes, which is often associated with the risk of hypothyroidism. Not only hypothyroidism, but there are many more diseases which are associated with the weight gain. So as now I said that millets can be compared or can be taken as a Trunadhanya. In Ayurveda, millet belong to the group of Trunadhanya Varga. And so our acharyas taken the millets as a Trunadhanya, Shudradhanya or Kudhanya. Millets are sweet, astringent, and the vipak is katu. So katu vipak, as it can be used for kapha prakopach vyadhi or santurpanokta vyadhi. The virya of millet is slightly hot and it is dry in nature. So wherever there is a disease which in term we have to do rukshan chikitsa, we may use these millets, as they are also dry up the kleda. The main property or the main function of millets are kleda shoshan and baddha vittakam and avrisham. They are non-aphrodisiac. So we can use this as on Tridosha, it increases the Vata dosha. So the Vata people and in Vata disorder, we may not use these millets, but they are very much useful in balancing the Kapha dosha. So Ayurveda emphasize, or Ayurveda can say that it is millets are beneficial for Kapha dosha. Some recipes of millets, like we can use some soups and whatever the daily meal, like roti, and we can go with the all type of dal and usal and laddu can be made, dosa, uttapam. Various menus are there which are beneficial, nutritional. They contain potassium, manganese, phosphorus, and so we can have this all. We can also use some type of soups and ushno like shadanga pani, some type of kashai. So I think this is from my side about the millets. Thank you very much. Done with my poster presentations.
Thank you, Doctor.
Thank you.
Let's say invite Dr. Gauri Vasandevkar for the paper presentation on the topic importance of Rasayana in the management of cow.
Thank you, doctor.
Dr.
Hello.
Gauri, are you there?
Yes, sir.
Okay, Doctor. Please share the screen, Doctor.
Hello. Sir, can you share my PPT slide?
Okay, 1 second, Doctor. I will share for you. Doctor, please start the session, doctor.
Hello.
Hello, doctor, please start, doctor.
Good evening, everyone. Myself, Dr. Gauri Devkar, Kaumar Bhritya Department from Yashwanta Ayurvedic College, Kodoli. Here is my paper presentation topic is Importance of Rasayan in the Management of Kaumar Bhritya. Please next slide, please. Ayurveda is the basic science of the traditional medicine system in India, considered in Balrog, that is Shushu, Bala, Kamarasta, under Kaumar Bhritya and mentioned different therapeutic for the treatment of the childhood disease. The herbal mineral formulation include such as a rasayan in the Ayurveda, prepare using the metal and minerals along with the herbs for the treatment of the various diseases or disorders. The defined concept of size and reduction involve the improving potency of herbal mineral formulation. The ancient literature reports use of the herbal mineral formulation for the treatment of the various childhood disease in Ayurveda. The use of the rasayan therapy in Kaumar Bhritya needs great attention toward the dosing and frequency to prevent any changes of adverse reaction in Ayurveda. Next slide, please. Aim and objective. The first one is to study in detail regarding of importance of rasayan in the management of the Kaumar Bhritya. Second one is to study the use of the herbal mineral formulation for the treatment of the various childhood diseases in Ayurveda. Next slide, please. Materials and methods. The materials were collected from the classical Ayurvedic literatures, magazines, and research journals. Next slide. The word rasayan is a composed of the two words. First is a rasa, and then second one is anion. Rasa explained to the fluid or juice of fire, and anion means pathway. Hence, the word rasayan means path of juice. It also means by which one get excellence of the rasa is known as a rasayan. Let us see the technical term rasayan refers, that means obtaining the optimal nourishment to the dhatus. According to the Shastra Samhita, the substance which decreases the aging process, increase the longevity, and increase the mental and physical strength, which destroy the disease process, is called as a rasayan. According to the Charak Samhita, the substance which invigorate a healthy person by producing the best quality of rasa, rakta, dhatu, and other dhatu called as a rasayan. In Ayurvedic textbook, rasayan defined as a drug, diet, and regimen which destroy the old age and disease called as a rasayan. That is, taking rasayan, we always remain healthy and young. That means you are in your old age, perform your normal duties. According to the Ayurveda, the rejuvenation takes place so that a person can become healthy and explore the spiritual aspect of life. Next slide, please. There are the types. The Kamya Rasayam, it is a usual, the fulfill desire. It is also used to promote the general physical and mental health. The Prana Kamya, it is used to achieve the best quality of the prana in the body. Veda Kamya, it is used for the enhancing the memory and intellect. The Shri Kamya, it is used for the promote of complexion. The Naimittika Rasayan, it is given to combat or balance of a specific cause which is causing a disease in the body. Next slide, please. Rasayan in Kaumar Bhritya. The Rasayan Tantra is a branch, comes under the branch of the Ashtanga Ayurvedic, which overall used to enhance longevity, intelligence, and immunity. The Rasayan Shastra also involves the use of metabolic formulation along with the herbs. In Ayurveda, the Gudichi, Shankapushmi, Jyotishmati, Mandukpani, etc. are the considered Rasayan. Rasayan boosts functioning of the Dhatu, Agni, Shrotas, and Ojas, and therefore act as a rejuvenator. Ayurveda describes the Rasayan also for the Balrog with a great care since Rasayan therapy may become the adverse effect in children if not used properly. Rasayan therapy also used as a preventive remedy in children, reduce the harmfulness since it is enhance the immunity and thus protect from various infectious diseases. Please next slide, please. In Ayurveda, there are the various herbal metallic formulation which may be used in a children's for the different therapeutic purpose, such as the Swarna Bhasma, Vacha, Madhu, Grita, Panchagavya Grita, Brahmi Grita, Abhyanga Grita, Savardhana Grita, Mandura Bhasma, and Loho Bhasma, etc. There are the 10 formulation of the Swarna and herb, Vacha and Brahmi along with the honey and get utilized for the newborn baby to improve their immunity and mental health in a Swarna Prashan. Raw gold after the rubbing on the stone along with the little amount of the water along with the honey and ghee administered to the newborn baby. This type of the formulation process may be therapeutic activity like antioxidant properties, immune modulatory activities, and also improves Agni like Dipan and Pachan. The Ayurveda suggests use of the Swarna Prashan with precautionary measurement to enhance the intelligence, mental activity, and immunity in the children. Please next slide. Low formulation, likewise, Trikatikadi Loha prescribed in a children's for Pandu Roga in the disease of the Pitta Prakriti of the children suffer predominantly. The Ayurveda strongly recommended use of the Loha in children suffer from the iron deficiency, that means Loha Shaya. Trikatrikaidi Loha contain the Mandur Bhasma and Loho Bhasma, along with the likewise Triphala, Trikatu, and Trimada. It is believed that the herbal ingredient help to iron transportation, thus improve the viability and also elevate the blood hemoglobin level significantly, and decrease the Loho in children suffer with the Pandu Roga. The literature mention use of Loho formulation in Rasai in other physiological dysfunction such as a weakness, anorexia, and fatigue. Please. Next slide, please. The paper influence management of Kamar Vidya using the various ancient approaches of Ayurveda science, such as the Rasayan with herbal remedies. This paper mentioned importance of the Rasayan in the management of the Kamar Vidya. Although use of the Rasayan in Kamar Vidya must be carried out with care. Rasayan therapy may be used in early age, but with the precautionary measurement and as per requirement. The discipline of the lifestyle also play the significant role in the management of the comorbidity. References. Done with my paper presentation. Thank you, sir.
Thank you, Dr. Gauri. Next, I invite Dr. Sachin Mahadik for the presentation. Dr. Sachin, are you there?
Yes, sir.
Okay, doctor, please share the screen, doctor.
Hello.
Hello, Dr. Sachin.
Yes, sir. Please share my PPT.
1 second, doctor.
Hold on.
Sachin, please start the session, doctor.
Yes, sir. Good evening, sir. I'm Dr. Sachin Sambhaji Mahadik from Yeshwant Ayurvedic Medical College, Kolhapur. Today's topic is Ayurvedic concepts of immunization in comorbidity. Next slide, sir. Comorbidity is a branch of Ayurveda that deals with all aspects of child health. Kashyap Samhita is the main treatise of comorbidity. It is used that Acharya Kashyap has derived the knowledge of Ayurveda from Bharadwaj. It is also called as Ruddha Jivak Tantra. There are some examples for Kashyap Samhita that point towards the concept of immunization, like importance of diet in prevention of disease, as Mahabhaishya Trisamgutika for prevention of disease. All acharyas have described various samskars in their texts, and one of the meanings of word samskar includes all the measures of immunization to induct proper resistance and strength as well. Samskars are indicated right from intrauterine life, and each of them makes the growing child to acquire newer talents. There are two main samskars performed during intrauterine life, namely Garbhadharan, produced for conception, Simantanayan in fourth month. In Garbhadharan Sanskar, both parents must be of eligible age for reproduction and must have desire for a child. Then it is indicated that their union in Ritukal produces a healthy pregnancy. Simantanayan Sanskar is done to fulfill craves of vitals, or in other words, Garbhini Dauryas. With the help of this ritual, deficiency of one or more nutrients or vitamins can be expressed, and its compensation from diet can be done. Along with these samskars, our ancient scholars have advised to do do's or don'ts for pregnant ladies under Garbhani Paricharya. This includes various rules regarding diet, exercise, clothing, medication, as well as holy rituals. Sattvaja Chikitsa helps for positive thinking, and a sound mind plays an important role in maintaining sound hormonal system. Jatmatra Paricharya. This includes following rituals: Swarna Prashan, Lehan, Shashti Sratri Paricharya, Abhyanga Snan, Dupan, Pichudarna. Swarna Prashan. Suvarna is one of the non-reactive metals known to mankind till date. Gold has stimulatory effects on peripheral macrophages that may prove helpful to fight against infection. There are mainly two requisites for the absorption of gold in the body: its therapeutic effects, reduction in the particle size, and existence of metal in human body in ionic form. Duration of Swarnaprashan. Kashyapa up to 6 months. Vagbhat up to 1 year. Dalhan Bharaprakash 1 to 12 years. Dosage 1:8 to 1:4 rati, 15 to 30 mg. Gold is administered with Gruta and Medhya drugs that enhance its rapid absorption as well as transport up to brain cells. Swarnaprashan is given on the special day of Pushya Nakshatra, as Pushya itself means nourish. Madhu has following therapeutic effects: removal of damaged connective tissue and cell dermis, formation of new blood vessels, stimulation of fibroblast proliferation, collagen biosynthesis, remodeling of connective tissue. Growth contains following components that help to enhance immunity: butyric acid, source of energy; lactic acid, potent antimicrobial, antifungal substance; conjugate linoleic acid, omega-3, omega-6 acid, essential for fatty acids. Lehana. Ayurveda highlights the practice of chanting mixture of equal amounts of ghee and honey in equal parts to neonates. The pollens in honey is known as antigen because these are collected from flowers of different rasa guna prabhav. Mixture with ghee may sustain this property of honey without being immediately metabolized in liver, as fat bypasses the liver to reach systematic circulation. Abhyanga and Snan. Abhyanga with bala tel prevents hypothermia. Larger surface of area are compared to weight contributes to heat loss in neonates. Snana with water medicated by aromatic drugs removes any microbes from skin surface in case of foul-smelling liquor. Aqueous extract of Ficus religosa has antimicrobacterial properties against Staph aureus or E. coli. Shashtiratri Paricharya. Ancient scholars have observed very closely about the most crucial period of infancy and marked it up to 6 days, during which neonates are most susceptible to various infections. Thus, special care should be taken during this period, and neonates should be closely observed for any abnormal signs and symptoms. Dhupan. After bath, fumigation is given with the help of Rakshogna dravyas like Khadir, Nimba, Shweta Sharshab. Khadir has proven antimicrobial property against Staph aureus. Vacha is antimicrobial for bacteria, yeast, and filamentous fungi. Pichudarna. Anterior fontanelle is protected by putting cotton pad soaked in bala oil. Bala oil prevents hypothermia, as head constitutes for large surface area of newborn. Colostrum is considered the first immunization for newborn. It is rich in the anti-infective factors that helps to protect the baby against diarrhea, respiratory, and other infections. Colostrum contains immunoglobulins as well as maternal antibodies. Breastfeeding infants are less prone for diabetes, heart disease, eczema, asthma, rheumatoid arthritis, and other diseases. Concept of Bal Rasayana. In today's era, we have disease-specific vaccines that provide protection against a single disease. But Acharya Kashyap emphasized the natural ways to build up immunity of children so that they can fight against any infection. For this purpose, he described the various Lehan Kalpas which can be given as Bal Rasayana. Important Medhya Rasayans in children. Yashtimadu, Brahmi, Shankapushpi, Mandukparni, Vacha, Suvarna, Kalyanagruta, Panchavagruta are important Medhya Rasayans in children. Bal Rasayan, Ashtang Abhaya growth, Samvardhan growth, Triphala, Lasuna, Vidanga, Pippali, and Gudichi. Concept of Kumaragar. This emphasizes maintenance of healthy environment for children. The bed, clothing, blankets, furniture, etc. of child should be cleaned, fumigated with Rakshogna dravyas like Sharshapa and Gugul. The neonate after performing Namakaran on 11th day should be transferred from Sutikagar to Kumaragar. This is done for the purpose of special nursing care so as to prevent drastic infections. Conclusion. Samskars are indicated right from intrauterine life, and each of them makes the growing child to acquire newer talents. Gold has stimulatory effects on peripheral macrophages that may prove helpful to fight against infection. Bal Rasayan is the natural ways to build up immunity of children so that they can fight against any infection. Kumaragar emphasizes the maintenance of healthy environment for children. Children make the home energetic and they are fate of our country. Keep up with cleanliness and calm climate for the appropriate advancement of the youngsters. Thank you, sir.
Thank you, Dr. Sachin. Let's say invite Dr. Akshada Gawali for the paper presentation. Dr. Akshada, are you there?
Yes, sir.
Okay, doctor, please
Just
share the
1 minute,
screen,
sir.
doctor.
Yes, sir.
Okay.
Sir, can you share my PPT, please?
1 second, doctor. I will share for you.
Yes.
Shada, please start the session, doctor.
Yes, sir. Good evening, all of you. This is Dr. Akshata, Comorbid PG resident, Yashwant Ayurved College, Kodoli, Kolhapur, Maharashtra. Today's my presentation topic is convulsion in children and approach toward the convulsion. Next slide. Now, the convulsion is the commonest emergency in children and is very scary situation for all family members and also physician. It is diverse etiologies. There are variable etiologies of convulsion according to the ages. Causes are different at the various age group. Neonatal age group, pediatric age group has different causes. And fourth is true convulsion versus convulsion mimic. There is convulsion mimic also there will be there. So we have to differentiate what is true convulsion or what is convulsion mimics. We will see in the presentation. First is definition. Second is etiology. Third one is emergency management in convulsion. Fourth is workup, how to work up. And fourth is seizure mimics. Next, please. Now, what is the definition of convulsion? It is the abnormal involuntary contraction or series of contraction of the muscles. There is a okay. Then now the causes of convulsion. The age group is 0 to 3 months. Okay, the first is hypoglycemia. Second one is hypocalcemia. Third one is a hypoxic ischemic encephalopathy. Fourth is meningitis, and fifth is the CNS malformation. These are the causes up to 0 to 3 months. Next, please. Now, what is the causes of 3 months to 5 years? There are two groups, with fever or without fever. If convulsion is with fever, then it is febrile convulsion will be there, meningitis will be there, encephalitis will be there, or cerebral malaria will be there. And without fever, if convulsion is without fever, then we have to approach towards hypocalcemia, epilepsy, any CNS malformation, or any trauma. Next, sir. Now, causes of 5 to 18 years. Here also two groups with fevers. With fevers is meningoencephalitis. The types are viral will be there, bacterial will be there, autoimmune or necrotizing. Or without fever, epilepsy, any trauma, a history of any trauma or intracranial lesions. Now, what is the emergency treatment of convulsion? Now we have to maintain the ABC. Then first is A means airway, B means breathing, C means circulation, and the fourth one is if the patient come will in the status epilepticus, then we have to load the IV midazolam. The dose is 0.2 mg per kg, which will diluted in 10 ml distilled water and push slowly over 5 minutes. Fourth is buccal midazolam, and fifth is midazolam nasal spray. 0.2 mg per kg is dose of the nasal spray, intranasally half in its nostrils. Then rectal diazepam, 0.2 mg per kg through the Ryle's tube. If convulsion is in the active convulsion is there, then give the position of the child like this, toward head tilted to the keep the airway open. Then hand support head and mouth is towards the ground, and the position of knee stop body from the rolling into the stomach. Next, sir. Now, what is the status epilepticus? Duration more than 5 minutes or 2 to more convulsion within the 5 minutes without gaining consciousness. That means the convulsion is status epilepticus. It having a high mortality rate and high neuromorbidity. Okay. Then what is the treatment protocol of status epilepticus? There is the 4 drug of choice for the status epilepticus. First is phosphophenolatoin, 20 mg per kg. Over 5 minutes. These all are loading doses. Injection levetiracetam having 20 mg per kg dose, and phenobarbital that is Gardinal, injection Gardinal having 20 mg per kg over 10 minutes.
And fourth one is the sodium valproate, same as 20 mg per kg. And after that, we can the midazolam infusion. And then emergency treatment on of the causes. If the convulsion due to hypoglycemia, then push the 10 mg dextrose 2 ml per kg IV stat. You can give the bolus of 10% dextrose. Then hypocalcemia. If the hypocalcemic convulsion is there, same dose are same calcium gluconate 2 ml per kg, which is diluted in the same amount of dextrose IV slowly over 10 to 15 minutes. Now, what are the investigations? If a conversion is without fever, then do the blood sugar, ionic calcium, and serum electrolytes. If conversion with having with fever, then do the CRP, CBC first, then CRP, malaria card test, and CSF. Next, sir. EEG also having the investigations which will confirmation the epilepsy, give the idea about choice of the long-term antiepileptic therapy, then help to know the type of epilepsy and prognosis, and herpes encephalitis. If there is herpes encephalitis, the specific wave are seen in the EEG. Then neuroimaging. CT has limited role only in trauma. If the convulsion is due to trauma, then only do the CT. Then MRI with epilepsy protocol is the best for convulsion. If the status epileptic having patient having the state in status, then do the MRI with epileptical protocol. Then indications are focal convulsion, focal neurologic deficit, and altered sensorium. Then do the MRI with epilepsy protocol. Next. Then now the features of typical febrile convulsion. This is the very commonest febrile type of convulsion. The convulsion within 24 hours of the fever onset. The febrile convulsion is single episode of convulsion, which is called simple febrile convulsion. If more than a single episode, then we can say complex febrile convulsion. High grade fever at the time of convulsion or within an hour of the convulsions. Then generalized clonic convulsion, and child is playful. This is the very temporary situation. After that, child is very comfortable and playful. Now, treatment of the febrile convulsion. First, do the ABC, that means airway, breathing and circulation. Maintain all these. Then rapid reduction of temperature. We have to reduce the temperature first. Then injection paracetamol 10 mg per kg IV. You can give the paracetamol IV 10 mg per kg. Then rectal paracetamol rectal suppository 20 mg per kg. Then tablet frisium. That means clobazam 5 mg half tablet twice a day for 3 days. The dose of the clobazam is the 0.2 to 2 mg per kg. Treat the cause of fever. Then treatment of epilepsy for GTC sodium valproate, then injection Levipil, injection phenytoin, injection phenobarbital, and for focal injection carbamazepine and injection oxcarbazepine. Next. Then what is autoimmune encephalitis? It is the immune mediated and varied presentation like ultrasensorium, unconscious or confused. The diagnosis is MRI, anti-MOG, serum anti-MOG, NMDA receptor antibodies. And treatment is IVIG, and IV immunoglobulin, steroids, and injection rituximab. Next. This is the one patient of autoimmune encephalitis which is on ventilator. Newer advance in treatment of the convulsion is video EEG, intracranial pressure monitoring, and gentle ventilation. Okay, thank you. Thank you, sir.
Thank you, Dr. Akshada. Next, I invite Dr. Amrita Ishant for the paper presentation. Dr. Amrita, are you there?
Hello, sir. Hello, sir.
Hello, Dr. Amrita. Please share the screen,
Please,
doctor.
sir, please share PPT for me.
Dr. Amrita, please start the session, doctor.
Okay, sir. Good evening, everyone. Myself, Dr. Amrita Bhoir, and my topic for presentation is role of Ayurveda in management of Kitib Kushta. Next slide, please. Okay. Introduction: Kitib Kushta, Ayurvedic aspect. In Ayurveda, Kushta is a term used to denote skin diseases. Kushta is Tridoshacha in origin. Vitiation of Tridosha followed by affliction of Tvaka, Rakta, Mausa, and Lasika leads to Kushta. These 7 factors that are involved in disease formation are considered as Saptadravya Sangra of Kushta. Kushta is classified into Mahakushta and Shudra Kushta. Kitiba Kushta is a variety of Shudra Kushta with dominancy of Vat and Kapha doshas. Present with symptoms Shavavarna, Kinikharasparsha, Parusham, Sravi, Ruttam, Ghanam, and Ugrakandu. Kitiba Kushta allopathy aspect. Psoriasis is a severe and chronic inflammatory hyperproliferative skin disease characterized by well-defined erythematous plaques with silvery white scales, particularly affecting extensor surfaces and scalp. Psoriasis classified into 4 categories: plaque psoriasis, gutted psoriasis, erythrodermic psoriasis, and pustular psoriasis. Based on similarities of clinical features and etiological factors, plaque psoriasis is similar to Kitiba Kushta in Ayurveda. Need and scope of study. It is noted that around 2% of population are touching with psoriasis. In this disease, patient suffers with severe itching along with hyperpigmentation and continuous scaling of skin, which causes both physical and psychological disturbance. The populations who are doing stress-oriented jobs and who are under stress due to poor economic and social background are more prone to this disease. Kitiba Kushta or psoriasis in patients create psychological stress over disease, as it is said that itching is stronger symptom. Skin diseases are commonly observed due to improper food habits, altered lifestyle, lack of physical exercise, mental stress. This disease having higher recurrence rate, utility of drugs in modern science has increased risk of hepatotoxicity and nephrotoxicity, giving an advantage to Ayurveda to help the patient with its non-toxic treatment. Next slide. Aim and objectives: to evaluate the efficacy of Ayurvedic treatment in Kitiba Kushta psoriasis. Materials and methods. Case report. A 67 years old female teacher presented with chief complaints of small, rough, hard, well-defined patches with blackish discoloration of skin over both lower extremities since 6 months, associated with severe itching due to continuous itching, wound formation with bleeding from lesions. Patient consulted an allopathic physician and was advised with antibiotic steroids and diagnosed it as psoriasis, but no relief was observed, so patient approached our hospital for treatment of the same. Clinical findings: the lesion type was blackish, hard, dry, and rough in nature with severe itching distributed over lower extremities. General examination: pulse 88 per minute, BP 130/90, SpO2 99%. Systemic examination: CVS is heard, no murmurs. Respiratory system: normal vesicular breath sounds heard, bilateral air entry clear. Per abdomen soft, not non-tender. Personal history: bowel is regular bowel, appetite good, micturition 6 to 7 times per day, sleep disturbed due to itching, diet non-veg 3 days in a week, excessive intake of fish and curd, occupation teacher. Psychological history: the patient was feeling embarrassed and depressed psychologically. Patient had more stress since 6 months back. The discoloration of patches increased day by day from 6 months. अष्टस्थान परीक्षा, नाड़ी 88 per minute, मल प्राकृत, मूत्र 6 to 7 times a day, जीवा अल्पसाम, शब्द प्राकृत, स्पर्शत्वक पारुषता and कृष्णता over both legs, दृक प्राकृत, आकृति मध्यम. Local examination: number of lesions multiple, size of lesions 0.5 centimeter, color of lesion black, side of lesion lower extremities, type of lesion plaques, scales texture dry, inflammation absent, distribution symmetrical, itching present, Severity of itching very severe with bleeding from lesions. Samprapti pathogenesis. Kushta is caused by morbidity of 7 factors, 3 dosha, Vat, Pitta, Kapha, 4 dhatus, Tvaka, Rakta, Mausa and Lasika, which are called as Saptadravya Sangra. Due to Nidan, aggravation of dosha, especially Vata Kapha, results in production of Ama Dhatu Shaithilya. The vitiated dosha along with Ama get settled into the Tvaka and Mausa, along with vitiated Rakta and Lasika leads to obstruction in Rasavaha, Raktavaha, Mausvaha, Svedavaha strotas, producing its symptoms. Next slide, sir. Dosha, Tridosha, Dusha, Tvaka, Rakta, Mausa, Lasika, Agni, Jatharagni and Dhatvagni Mandya, Strotas, Rasa, Rakta, Mausas and Svedavaha, Strotodushti, Sanga and Vimarga Gamana, उद्भवस्थान आमपक्वाशय संचार सर्व शरीर अधिष्ठान त्वचा व्याधि मार्ग बाह्य स्वभाव चिरकारी. चीफ कंप्लेंट्स शावता हायपरपिगमेंटेशन किणिखिरी स्पर्श रफ पारुष्यम कोर्स वृत्तम राउंड घनम थिक उग्रकंडू सिवियर इचिंग. देन ट्रीटमेंट दीपन पाचन स्नेहपान सर्वांग अभ्यंग नाडी स्वेद प्रक्षालन and विरेचन was given. First is दीपन पाचन, day 1 to day 3 Chitrakadi Vati, 1 tablet BD. Then Snehan and Shodhan, from 4th day to 8th day Panchatikta Ghruta. On 9th and 10th day Sarvanga Abhyanga with Nimbatela followed by Nadi Sveda. On 11th day Sarvanga Abhyanga with Nimbatela followed by Nadi Sveda and followed by Virechan Karma with Trivritta Leha 30 ml. Patient had 12 Vegas, Madhyam Shuddhi during Virechan Karma. Sansarjan Karma included Peya Vilepi Yusha Krushara for 5 days was explained to the patient. Shaman treatment, Arogyavardhi Vati, 1 tablet BD after food, Mahamanjishtadi Kashai 50 ml with 45 ml lukewarm water BD before food, Khadirarishta 30 ml with equal amount of water BD after food, Panchanimba Churna 5 gram OD with lukewarm water, Triphalakvat Prakshalana. Medicines were given for 15 days. Proper assessment and evaluation was done 15 days after treatment. Patha 7 Ahar, light food, leafy vegetables with bitter taste, food prepared by boiling with Triphala, Nimba, etc. Avoid spicy, salty, oily food items, junk food, non-veg and curd, vihar, khadir decoction bath. Next slide, sir. Then observation. Number of patches, absent, single patch, segmentary, generalized, Shavta, normal skin color, mild discoloration, moderate discoloration, severe black discoloration, Kinekhirisparsha, normal skin texture, mild rough lesions on touch, moderate rough lesions on touch, severe rough lesions. Parushatva, normal skin, mild hardness of lesion, moderate hardness of lesion, and severe hardness. Kandu, no itching, mild, occasional, localized itching, moderate, generalized itching, severe itching, disturbing sleep and other activities. Next slide, sir. Then we can see the results. Next slide, sir. Discussion. In the present study, the patient present with the complaints like blackish discoloration with severe itching. The texture of the lesion was hard and rough. From Ayurvedic point of view, lakshanas like Shavta, Parushata, Kinkhira Sparsha, Ugra Kandu were present, indicated the involvement of Vata dosha, and Kandu indicated the involvement of Kapha dosha. The case was diagnosed as Kitibakushta psoriasis. As mentioned in Viruddhahar, fish, curd, etc. becomes the cause of manifestation of skin eruptions resulting in the presentation of Kushta. Based on the dosha involved, Vata Kapha Hara line of treatment was planned in the terms of Shaman and Shodhan Chikitsa. In the Shaman Chikitsa, both internal and external medications were included. Virechan Karma followed by Shaman Chikitsa along with Patha Ahar and Nidhan Parivarjana. The treatment was started with Chitrakadi Vati for Am Pachana and Agni Dipana as it has Kafagna, Vatagna and Amadoshnashak properties. Then Snehapana with Panchatikta Grita. This Grita is Tikta Pradhan. The Tikta Rasa help in Kleda Shoshan and Kafaharan. So effective in the symptoms of itching, dryness, thickness of the lesion. Snehapana also help in dosha utkleshana, that is bringing the leena dosha into a leena dosha avastha. Next slide, sir. After obtaining the Samyak Snigdha Lakshana, Sarvanga Abhyanga with Nimba Tela and Nadi Sveda was given. Nimba contains Tikta Kashaya Rasa with the Lagu and Ruksha Gunas, Shita Virya and Katu Vipak. Nimba is Vata Shamak and anti-inflammatory, acts on blackish discoloration, scaling, roughness and hardness of Kitiba. Nadi Sveda helps in opening pores of skin. Abhyanga Nadi Sveda was administered to achieve dosha Saithilyakarana and brings dosha from Shakha to Koshta. After Abhyanga and Svedana, Virechana was administered with Trivritta Leha. Trivritta is Vatanulomak and Sukha Virechak. The separated morbid dosha are eliminated by Virechana. It helps in the removal of vitiated dosha out of the body along with toxins. After Shodhana followed by Sansarjan Krama, the patient was administered with Arogyavardhini Vati, Mahamanjishtadi Kashaya, Khadirarishta, Panchanimba Churna. The internal medicine help in the Mrudu Shodhana as well as help in Strota Shodhana. For external treatment, Triphala Kvat was given for the purpose of Prakshalana. It helped in bringing down the amount of kledha and pacify Amavastha. The patient was advised to give a follow-up after 15 days. The condition was better with good improvements when assessed 15 days after treatment also. There was significant reduction in all the lakshanas like Shavta, Parushata, Kandu, etc. The lesions become hypopigmented after Virechana Karma. Even though Madhyam Shuddhi was attained, there was remarkable improvement in the patient. Conclusion. The purpose of the present study was to evaluate the efficacy of Ayurvedic treatment in Kitibakushta psoriasis. Kitibakushta was similar to psoriasis due to the similarity in its symptoms. It is one of the severe skin disease which is Kurchasadhya. In present case, Shaman and Snehapan followed by Virechan show effective result in symptoms of Kitibakushta. Hence, it can be concluded that Shodhan and Shaman along with proper Pathya and Vihar Sevan is effective and gives relief from the symptoms of Kitibakushta. Shodhan at regular intervals should be done in order to prevent the relapse of the condition. These are references from Ayurvedic texts. Thank you.
Thank you, Dr. Amrita. Next, I invite Dr. Saudi Sesraju Umak for the paper presentation. Dr. Saudi, are you there? Hello, Dr. Saudi, are you there? Dr. Saudi Sesraju Umak, are you there?
Hello.
Hello, doctor.
Hi, yes, sir.
Please share the screen, doctor.
Hello.
Hello, you are
Hello.
audible, doctor. Please share the screen, doctor. You are audible, doctor.
Hello. Good evening, everyone. Hello.
Good evening, doctor. You are audible, doctor. Please share the screen, doctor.
Sir, can you please share my PPT?
1 second, doctor. I will share for you. Doctor, please start the session, doctor.
Myself, Dr. Swati Umar, PG Scholar of Kaumarvritya Department from Yashwant Ayurveda Hospital and Research Center, Kolhapur. My topic is enhancement of health status of a child with delayed developmental milestone by Panchakarma therapy. It is a case study. Next slide. Next. Next slide, sir. Hello. Introduction. Child development refers to the process in which children grow through changes in skill development during predictable time period for developmental milestone. Developmental delay occurs when children have not reached this milestone by the expected time period. Developmental delay can occur in all areas of development. Next. A 2-year-old baby was diagnosed as a delayed milestone, given classical treatment according to Ayurveda, test to enhance health status of child with developmental milestones, given Shaman Chikitsa and Panchakarma procedure like Snehan Svedan, Shashti Shalipinda Swed, Nasya, Shirupichu, Padabhyanga, which was indicated in this condition according to Ayurveda. Next. Aim and objectives. Aim is to study the Ayurvedic management in delayed milestone. Objective is enhancement of health status of child with delayed developmental milestones by Panchakarma therapy. Next. Material and methods. In this case study of delayed developmental milestone, compare with Upadravayukta Dhatukshayjanya Vatvadi, a 2-year-old female child having symptoms like unable to hold her neck, unable to hold small objects, unable to grasp objects, unable to sit with or without support, rolling of saliva, excessive cry, vision squint, and speech, with confirmed diagnosis of global delayed developmental milestones. Next. Management contains, Chikitsa contains 3 steps. First is Pachan. It is given by Ampachakvati. Second is Saman Chikitsa, include various kalpas like combination of Vidari, Bala and Ashwagandha. Second is Brahmi, Vacha and Jatamasi, Chavanprash and Shatavari kalpas. Third step is Shodhan. It includes Snehan by Mahamash Tel, Bala Tel. Second is Svedan. It is given by Nadi Sved, Shashti Shalipinda Sved. It contains Dashmul, Erandmul, Bala, Ashwagandha, Devdar, Manjishta, milk and Shashti Shali. Third one is Nasya. It is given by Panchandriya Vardhan Tel. Fourth is Shiropichu, given by Brahmi Tel. And fifth one is Padabhyanga. It is given by Ghritas. Next step. Result. Significant results were observed and the milestone which were developed, they were achieved. We can see this slide. Next, please, sir. Discussion. According to birth history, as a hypoxic event occurred, she has having delayed developmental milestone. As she did not cry immediately after birth, so some hypoxic ischemic event occurred which resulted in neuronal damage in brain, which lead in developmental delay. As the neuronal changes are irreversible, but clinically symptoms were correlated with Upadravayukta Dhatukshayjanya Vatvadi. So treatment given according to Dhatukshayjanya Vatvadi and improvement found in her both growth and development wise. Next. History of birth asphyxia at birth, that is its Agantuj Hetu, which caused structural damage, which was also irreversible. But when used opposite gunas, Tel, Ghritas for Abhyantar and Bahya Snehan, child started improving clinically and shown overall 60 to 65% growth. Next. Probable action of therapy. Tela used for Snehan like Balatel, Mahamash Tel, used for Abhyanga, has Briham, Snigdha and Vata Shamak properties. Drug used for Shashti Shalik Pindasved have a Snigdha Guru Balya properties. Skin is considered to be site of Vata. It occupies Sarvashira. All the gunas of Sneha and Svedna are opposite to properties of Vata dosha. Next. These measures, when directly applied on skin, lead to correction of degeneration function and degeneration function of Vata dosha, which in turn corrects impaired function. Balya guna of this drug improves Mansa Dhatu and intellectual Vyadi Shaman in Mastulanga Majja. Medhya Chikitsa is used for improve Majja Dhatu functions. Next. Conclusion. Overall result is 60 to 65%. As modern medicine don't have appropriate specific treatment modalities regarding this problem, Ayurveda can provide a better improvement in development. Small improvement in earlier age, major benefits at later age in the form of developing skills. Scope for further management: Basti Chikitsa, Yoga Basti Karma, physiotherapy and speech therapy. Thank you, sir. Thank you all.
Thank you, Dr. Swati. Next, I invite Dr. Shubham Pidambar Patel. Dr. Shubham, are you there? Hello, Dr. Shubham Pidambar Patel, are you there? Hello, Dr. Shubham, are you there? Okay, next I invite Dr. Mukta Ritnadeep for the paper presentation. Dr. Mukta, are you there?
Hello, sir.
Hello, doctor. Please share the screen, doctor. Your screen is visible, doctor. Please start the session.
Good evening, everyone. I am Dr. Mugdha Ratnadeep Malvankar, second year PG scholar from LRP Ayurvedic Medical College, Islampur, District Sangli. Today, my presentation topic is a case study on Ayurvedic management of Manyastambha with respect to cervical spondylosis. Abstract. Cervical spondylosis is a very common condition seen nowadays. It is estimated that 9 out of 10 adults will have some degree of cervical spondylosis. Degeneration of cervical vertebra is most seen in elderly people, but nowadays, due to overuse of computer technology, most of people develop cervical spondylosis. In the present case of study, a diagnosed case of cervical spondylosis has been included for this Ayurvedic management. Chief complaints were pain and stiffness over the neck, and since 6 months, and pain over the neck was radiating towards the right arm. Externally, Manyabasti and Nasya was given, and during this procedure, Ayurvedic medicine also given. Different parameters have been assessed before and after the treatment schedule. There is a complete relief in parameters like neck pain and stiffness, whereas the parameter like pain in arm has also shown significant improvement. Aim of this presentation is to study the effect of Ayurvedic management of cervical spondylosis in the early remissions of disease as per Ayurveda in terms of Manyabasti and Nasya Chikitsa. Objectives: to understand pathophysiology of cervical spondylosis in Ayurvedic and modern perspective, to understand treatment of cervical spondylosis according to Ayurveda. Material and method: in this inclusive criteria is patient of either sex with presenting symptoms of cervical spondylosis, patient above 18 years and less than 70 years of age, clinical symptoms with or without radiological changes. Exclusion criteria: stenosis of spinal canal, myopathy, myofascial pain syndrome, patient suffering from any acute disease or any infectious disease or metabolic disease or chronic disease like rheumatoid arthritis, SLE, ankylosing spondylitis. Introduction. According to Ayurveda, cervical spondylosis resembles Grivastambha, a disorder of Vata. Vyanavayu is responsible for the movement of the body. देहव्याप्नोति सर्वं तु शीघ्रगति नृणां गति प्रसारणा आक्षेप निमेषादि क्रिया सदा. The Purvarupas of Vatavadi are avyakta. When they are manifested, it is their Atmarupa. Some of the lakshanas of Kapitu Anilaha Vayu are similar to the sign and symptoms of Manyastambha. These are Paniprishta Shirograha, Gatra Suktata, Griva Vyana Danama, Bheda Arati. Cervical spondylosis or osteoarthritis of cervical spine produce neck pain radiating to the shoulder or arms with headache in posterior occipital region. Narrowing the spinal canal by osteophyte, ossification of the posterior longitudinal ligament or a large central disc may compress the cervical spinal cord. Then disease review. In Ayurvedic perspective, Manyastambha is one of the 80 type of Vatavadi, which is characterized by stambha, stiffness in the neck region, which is commonly seen in cervical spondylosis. Cervical spondylosis may also considered as a Grivagat Sandigat Vat, especially in degenerative condition. Pain during the flexion, extension of the joint, along with the swelling and coarse crepitations on joint movement is a typically clinical features of Sandigat Vat. Acharya Sushrita has described Manyastambha, which is caused by Divaswapna, sleeping during a daytime, usually pillow inappropriately during the sleep, and constant gazing in upward direction, leading to the vitiation of Vata and Kapha dosha. Such condition may stimulate with the condition of cervical spondylitis or acute stage of cervical spondylosis. Cervical spondylosis is a broad term which describes the age-related chronic disc generation, which can also affect the cervical vertebra, the facet, and the other joint and their associated soft tissue support. Chronic disc degeneration result in increasing mechanical stresses passes through the cervical spinal column, resulting in osteophyte formation and secondary degenerative changes in surrounding structure, such as the facet joint, the posterior longitudinal ligament, and the ligamentum flavor. These degenerative changes and their associated nerve impigmented are then responsible for their clinical syndrome in which cervical spondylosis present. Causative factor. There is a three main causative factor according to Ayurveda, that is aharaj is a food habit, viharaj is a bad habits, and manasik, that is psychological factor. In aharaj factors, intake of dry, cold or frozen food, fasting for long period leads to increased vata dosha and depletion nourishment of body. Untimely intake of food, junk food or sodas, less intake of water and liquid. Viharaj. In Viharaj, people who carry heavy workload on their shoulders are more likely to develop cervical spondylosis. Night awaking, day sleep, heavy exercise, walking or bike riding for long distance are other Viharaj habits. Manasik. Stress, grief, anger, fear, loss of interest in work. Then clinical feature. Pain in the neck, difficulty in a usual function of the neck like rotation, flexion, extension, etc. Radiating pain to the shoulder, forearm, muscular spasm, numbness, joint stiffness, fatigue, headache, tingling sensation, numbness, weakness in arm, difficulty in walking, lack of coordination. Case study. A 41-year female beautician by profession has visited OPD with chief complaint of pain and stiffness over the neck region since 1 year. Pain over the neck is radiating towards the right arm. She is also having tingling sensation over the neck and arm. She is also suffering from constipation. After consulting an orthopedician for the same problem, she did her MRI of cervical spine, which reported degenerative changes with osteophysis at C5 and C6 vertebrae with nerve compression. She was diagnosed as a case of cervical spondylosis with a radiculopathy. She is advised to take analgesic and anti-inflammatory medicine regularly for some initial time period and then followed by their occasional use when needed. She had also undergone physiotherapy session for about 15 days and got mild relief in symptom. Investigation like hemogram, ESR are within normal limit. On examination, patient is having tenderness over the neck. Neck pain is increasing with forward and backward movement of shoulder, but relieves on abduction. Therefore, there was no history of hypertension, diabetic mellitus, tuberculosis, and other serious illness. No relevant congenital and surgical illness were found. Pulse is 78 per minute, weight 65 kg, BP 130-80 mm of Hg, respiratory rate is 18 per minute, that is regular, and patient was afebrile, tongue is normal, bladder habit was normal, bowel constipated. Throughout examination, a diagnosis of Grivagatvat, that is cervical spondylosis, has been established, and patient is advised for Manyabasti and Nasya with oral Ayurvedic medicine. Following material were required in the case study. For Manyabasti, we required masha, that is black gram flour, 500 gram, shirbalatil, 500 ml, dashamulakvat, 2 liter, 1 spatula, 1 small piece of sponge, water as per requirement, and Nadi Svedan Yantra. For Nasya, we require 101 balatil, hot water pot, towel, cotton swab, gokarna, kidney tray, or spitting vessel. Treatment plan. a schedule has been planned with a 2 therapy session of Griva Basti and Nasya, 6 days in each session, and 7-day gap in between each session. Along with this patient is advised to take following Ayurvedic medicine throughout the treatment schedule. Tablet Trayodashanga Gugur 500 mg twice a day with lukewarm water, and Dashmulkvat 20 ml twice a day after lunch and dinner with lukewarm water. Griva Basti. First treatment is Griva Basti. Griva Basti is a distinctively developed Ayurvedic procedure which is done primarily to pacify aggravated dosha in neck region. Procedure for Griva Basti. Paste of masha, that is black gram flour, is traditionally used to make circular boundary wall in a Griva Basti. Whereas the present case study, plastic Griva Basti molds has been used. These molds are available in different sizes. Patient is asked to lie down in a prone position on the table, and towel roll is placed under the chin to make neck region slightly flexed. After this, plastic mold placed over the neck and its margin are sealed with a masha paste, then kept for 5 to 10 minutes to settle. Now heated Kshirbala tel is poured in the Griva Basti yantra by using the sponge piece. Precautions should be taken to maintain oil temperature as tolerated by patient and also for leakage of oil for Basti yantra. The oil in the Basti yantra has to be replaced with warm oil at regular interval. After doing this procedure for 30 minutes, oil is drained out and plastic mold is removed. After this, a gentle massage is done over the neck and upper back region, followed by Nadi Svedan, that is local fermentation with Dashamulakvat. Then Nasya treatment. Nasya is one among the 5 purification procedure, that is Panchakarma procedure. It includes installation of medicine through the nasal route, and it's mainly indicate for the disease that affect the region above the clavicle bone. It pacifies Vata and Kapha dosha presenting head region. Procedure for Nasya. Procedure of Nasya is done after the 10 minutes of Manya Basti. Purva Karma is a local abhyanga. Face and neck and of the patient were ointed with the lukewarm bala tel and then massaged by specified manuals like linear thumb movement over the forehead, nose, chin, and maxillary area, and circular movement of palm over cheek and temporal region. Mridu Sveda. The towel was soaked in a boiling water. After this squeezing the water, towel was waved, touched, and pressed. Don't face the pressed on the face and neck region. Positioning of the patient, supine position by bending the head about 45 degrees. Pradhan Karma. Administration of medicine, lukewarm oil was poured with the instrument Gokarna in each nostril one by closing the other nostril, and patient asked to sneak the medicine so that reaches to deep inside the nose. Duration of day 7 days. 101 Shirbala tel is used for Nasya Chikitsa. Dose 6 drop in each nostril. Pachat Karma. The patient was asked to spit out medicine that reaches the throat in beside the kidney and or spitting vessel. Kavala, that is gargling with lukewarm water, was advised just after the procedure. Assessment criteria. There are 3 assessment criteria. Each has 4 grades. That is neck pain, neck stiffness, and pain in arm. 0 means absent. 1 is mild or intermittent pain. 2 is moderate and bearable pain, and 3 is severe or unbearable pain. According to criteria, clinical assessment are done. A neck pain, stiffness, and pain in arm before treatment is 3 grade, and after treatment, neck pain and stiffness reduces, and 0 grade is there, and pain in arms is reduces, but slight pain is there. Conclusion. As per clinical assessment, demonstrate clinical improvement in cervical spondylosis with Panchakarma and Ayurvedic medical intervention. Discussion. Manyastambha is a Kapha Pradhana Vata Vyadhi, even though is mentioned in a Vata Nanatmaj Vyadhi by all Bruhatrais and Lagutrais. Treatment mentioned in all the in Vata Kapha line of a treatment with the drug possessing Vata Kapha Hara. The results were assessed on the basis of symptomatic improvement using clinical findings. Cervical spondylosis is emerging a widespread problem in a society due to the overuse of computer technology, lack of exercise, and interrupted posture. Manyabasti is a procedure where Bahya Snehan and Swedan done due to warm oil, cervical region, blood supply of the part is increased and inflammation is reduced. Nasya in the management of Udvachatrugat Vikaras in classic. Acharya Charak indicate Nasya therapy exclusively for the management of Manyastambha. Furthermore, it is stated that symptoms such as Gaurav, Stuti, Stambha, and Shishula should be treated with the appropriate drug to demolish the pathology. Thank you.
Thank you, Dr. Mukta. Next, I invite Dr. Nikita Khandekar for the paper and poster presentation. Dr. Nikita, are you there?
Yes, sir. Am I audible?
Audible, doctor. Please share the screen, doctor.
Okay.
Your screen is visible, doctor. Please start the session.
Okay. Welcome to the Department of Kriya Sharir. Myself, Dr. Nikita Gunwant Khandekar, PG Scholar First Year Kriya Sharir Department, GSC Usmanabad. My today's paper presentation topic is Physiology of Shock. Introduction. Shock is a physiologic event with many different causes, but if untreated, it has a single clinical outcome. Mortality rate is about 20%. Different definitions of shock. Shock is a life-threatening situation due to poor tissue perfusion with impaired cellular metabolism, manifested in turn by serious pathophysiological abnormalities. Shock is a term used to describe the clinical syndrome that develops when there is critical impairment of tissue perfusion due to some form of acute circulatory failure. Shock may be defined as inadequate delivery of oxygen and nutrients to maintain normal tissue and cellular function, the state in which profound and widespread reduction of effective tissue perfusion leads first to reversible and then, if prolonged, to irreversible cellular injury. The basic defect of shock. Shock versus the circulatory shock. It is characterized by reduction in circulating blood volume and results in inadequate tissue perfusion. It may be hypovolemic, marked expansion of vascular tree, loss of pumping ability of heart. Early manifestation of shock, low BP, systolic less than 100 mm of Hg, rapid thready pulse, tachycardia, cold clammy skin, rapid shallow breathing, irritability, drowsiness, confusion, increased thirst, oliguria, and multiple organ failure. The common features of shock, poor tissue perfusion, impaired oxygenation, impaired nutrient supply, decreased removal of waste, and it might be progressive. Hypovolemic shock. So from here onwards, we'll see the types of shock. First is hypovolemic shock. Shock due to reduced blood volume. Hypovolemic, it is called as hypovolemic or cold shock. Traumatic shock, hemorrhagic shock, surgical shock, burn shock, dehydration shock. Common causes of shock, in hemorrhagic, it might be trauma, gastrointestinal bleeding, and in non-hemorrhagic, external fluid loss, diarrhea, vomiting, polyuria, fluid redistribution, burns, and anaphylaxis. Loss of fluids, fluid loss, blood, water, electrolyte, plasma. Typical example, hemorrhagic shock, when loss is more than 15 or 20%, compensation of the loss. Compensatory mechanisms can be short-term or long-term. Hemorrhagic shock. Hemorrhage, it leads to low blood volume, leads to low venous return, low stroke volume, low cardiac output, which ultimately leads to fall in systolic pressure, a fall in pulse pressure, which results in diminished blood flow to tissues with low O2 concentration and high CO2 concentration and high H plus ion. Compensatory mechanisms. Shock is prevented by baroreceptor mechanism where BP is maintained. Plasma volume is maintained where low plasma volume leads to fall in systolic pressure, fall in capillary hydrostatic pressure. It leads to filtration where it is more than reabsorption, which leads to restoration of plasma volume. Tissue oxygenation is maintained by local vasodilation and increased respiration by chemoreceptor reflex, restoration of blood components by erythropoiesis, plasma protein synthesis. Treatment of hypovolemic shock, replacement of losses as far as possible. In place of blood plasma, expanders can be used. If only plasma and electrolyte are lost, blood should not be given. Components of blood in place of whole blood should be given. Recumbent posture with head and slightly lowered foot end should be raised slightly. Room temperature comfortable, breathing a mixture of oxygen and 5% CO2. Painkiller and tranquilizer may be given, but no respiratory depressants should be used. Antibiotics are given. Treatment of specific cause of shock is given. Irreversible shock, if treatment is delayed, no response to treatment, loss of fluid from capillaries, that is, fluid continues to be lost, vasodilators to relax the arterioles might help here, and corticosteroids which may reduce capillary permeability. Hypoxia may induce renal failure, which further compromises cardiac functions. Reduction of blood flow to gut, it increases intestinal permeability, which results in absorption of bacterial toxins, damage to liver, leads to toxins enter to the circulation, leading to endotoxic shock or gram-negative shock. Reduction in coronary blood flow due to tachycardia, myocardium is damaged by toxins, which ultimately results in decreased cardiac output. A great decrease in BP, it results in baroreceptors. Baroreceptors becomes ineffective, and then cerebral ischemic response last effort. It results to when vital centers of brain are involved, which results in irreversible shock. Cardiogenic shock, decrease in cardiac output, decrease in circulating blood volume. It may be caused by disease of any disease of heart, coronary blood vessels, and pericardial effusion. Neurogenic shock, severe pain, profound emotional disturbances, brain damage, widespread vasodilation in capacitance vessels, pooling of blood in veins, decrease in venous return, decrease in cardiac output. Neurogenic shock, primarily due to blockage of sympathetic nervous system, loss of arterial and venous tone with pooling of blood in the dilated peripheral venous system. The heart does not fill, the cardiac output falls. Neurogenic shock may be caused by paraplegia, quadriplegia, trauma to spinal cord, spinal anesthesia. Clinical features, warm skin, pink and well perfused. Heart rate is rapid, blood pressure is low, urine output may be normal. Next is vasovagal or vasogenic shock. It is a part of neurogenic shock. Pathophysiology, pooling of blood due to dilatation of peripheral vascular system, particularly in the limb muscle and in splanchnic bed. This causes reduced venous return to the heart, leading to low cardiac output and bradycardia. Blood flow to brain is reduced, causing cerebral hypoxia and unconsciousness. Its management is Trendelenburg position. It increases the cerebral flow and consciousness is restored. Psychogenic shock, it is also part of neurogenic shock. It occurs following sudden fright from unexpected bad news or at the site of horrible accident. Effect may vary in intensity from temporary unconsciousness to even sudden death. Anaphylactic shock, hypersensitivity reactions can lead to release of histamine and other vasodilatory substances, which increase in capillary permeability results in shock. Septic shock, uncontrolled infection leads to release of bacterial toxins, which leads to generalized vasodilatation and increase in capillary permeability resulting in shock. Thank you.
Thank you, doctor. Next is the poster presentation.
Yes, sir. It is visible, sir.
Yes, screen is visible, doctor, but it's in the PPT. Your poster is not visible, doctor.
It is visible, sir.
No, doctor.
Okay. Is it visible, sir?
Yes, doctor. Now visible.
Okay.
Please chat, doctor.
Yes, sir. My poster presentation topic is fighting pandemic by improving the health with Ayurveda and yoga. As we know that in the year 2020, when pandemic was declared, especially in India, the Ayurvedic formulations was followed by many people. And we all know that the prayojana of Ayurveda is Sastasya Swastha Rakshanam, Aturasya Vikar Prashamanam cha. So Ayurveda not only treats the ill, but also helps to maintain the health of a healthy and to boost the immunity. So need for study, the mind and body are not separate. What affects one affects the other. Ayurveda defines health as a state of equilibrium of the doshas, that is energy principles, and Agni, digestive and metabolic fire, dhatus, that is we can compare it with tissues, malas, excretion, and homeostasis, which is most important balancing factor involving a blissful state of spirit, sense organs, and mind. During global pandemic of COVID-19, people who were not headstrong required an extra care or assistance. Studies have estimated that there is an increase of about 35% in the prevalence rate of anxiety and depression in India during the pandemic. It had a major impact on individuals' mental health. So, according to Ayurveda, health of body and mind depends upon the four factors: ahar, that is food; vihar, that is recreation; achar, that is the routine we follow; and vichar, that is the thoughts. So, in ahar, food is said to be the Mahabhishajya, the best medicine. Right food intake counts for well-being. Sattvic food helps to achieve the stability of the mind. And in Ayurveda text also, various acharyas have mentioned the Viruddha Ahar. So whatever the rules and regulations are given regarding Viruddha Ahar, we should follow it promptly. Vihar means walking or moving, engross mind in activities like gardening, playing, listening music, or any activity that would please our mind. And in Ayurveda, according to Dosha Vruddhi, we can do it, we can follow the Vihar, just like in Kapha Vruddhi. If Kapha Vruddhi is there, we can follow the exercises and do yoga. Next is Achar. It means routine. Ayurveda has described Dinacharya, that is daily routine, and Rutucharya, that is seasonal routine. Regularity and sincerity is required for daily routine to achieve the goal. And in Charak Chikitsa Sthan, Acharya Charak has mentioned the Achara Rasayan in Rasayan Chikitsa, which is one of the most important rasayan to be followed by everyone to boost our immunity. Next is Vichar. Our mental health directly depends upon how we think. Yoga, asan, dhyan, and pranayam is the best way to increase concentration power of mind. Sukha dukha uplabdhi karanam manaha. So whatever our mind thinks, it ultimately balances our hormonal changes. So it is very important to think positively in any phase of our life. So conclusion, people with a strong willpower and positive thinking fare better in the recovery process of any disease. The patient has to put in their trust in the treatment provided to them. A good and positive mental health helps the patient as to experience lesser anxiousness, reduce stress levels, which almost always amounts responsible for any disease there is. In conclusion, people who are optimistic and have good mental health are more likely to be cured faster and less likely to fall ill. Thank you so much.
Thank you, doctor. Next, I invite Dr. Vaishnavi Anil Sarangdan for the paper presentation. Dr. Vaishnavi, are you there? Hello, Dr. Vaishnavi Anil, are you there? Hello, Dr. Vaishnavi Anil, are you there? Okay, next I invite Dr. Vaishnavi, are you there? Dr. Vaishnavi, we can't hear your voice, doctor. Hello, Dr. Vaishnavi, we can't hear your voice, doctor. Please reconnect your headset. Okay, next I invite Dr. Vandana for the paper presentation. Dr. Vandana, are you there?
Yes, sir.
Okay, doctor.
Sir, can you please share my slides?
1 second, doctor. I will share for you.
Yes, sir.
Hello, Dr. Vandana. Please start,
Yes,
Doctor.
sir. Yes, sir. Hello, good evening, everyone. Myself, Dr. Vandana Ramalu Mamidala, and my today's paper presentation topic is Yoga in Garbhini Paricharya. Next slide, sir. I'm from Redekar College. Abstract. Yoga in pregnancy is multidimensional. Yoga in pregnancy is multidimensional physical, mental, emotional, and intellectual preparation to answer the challenges faced by a Garbhini, that is pregnant woman. The challenges of pregnancy are revealed by the state of happiness and stress, while yoga is a skill to calm down the mind. So pregnancy in a woman is a condition in which woman changes from both inside as well as outside. These changes create obstacles or hurdles in the normal life of a pregnant woman, and yoga in pregnancy can help the woman to cruise through these changes and challenges. Practicing yoga during pregnancy provides a great range of activity and benefits to unborn child and mother by numerous ways. Yoga soothes the mind, refocuses the energy, prepare the woman physiologically and psychologically for labor. Different breathing techniques impart valuable neuromuscular control and helps in coordinating relaxation and contraction of the uterus. An approach to yoga in pregnancy can improve birth weight, decrease preterm labor, decrease IUGRs with least or no complications. Introduction. Pregnancy itself is not a high risk condition as it is a normal part of reproductive life. Most pregnancies can have a healthy and happy outcome. Here, collaboration of ancient branch of yogic science and pregnancy. There is a lack of research which shows that yoga can actually help. Even the few studies which have been done have not been sufficient in the public eye, and there is a need to highlight the miraculous role of yoga and pranayam in the human life. So there is a need for more and more research works and articles in this discussion. For an expectant mother, practicing pranayam is as important as performing the asanas. Pranayam and the asana together bestow physical and mental health both to mother and fetus. Pranayam should be practiced in the complete pregnancy period. Aims and objectives: to give the systemic and comprehensive knowledge about yoga in Garbhini, to explain the importance of yoga in Garbhini, to explain efficacy of yoga in Garbhini Paricharya. Methodology. Pregnancy is a beautiful phase in women's life. Birth should not be risky both for mother and child. However, extra care needs to be taken by women during pregnancy. Good lifestyle can release the physical stress and mental stress and facilitate the good condition for childbirth, and yoga is considered as a best tool for achieving this. Yoga definition. Yoga uses a series of body positions called posture and breathing exercises. Prenatal yoga poses designed to build strength where it's needed, as in the legs and lower back, but also cultivate the skill of being able to release tension, tightness, and ultimately pain from the body. Definition of asanas. Yogasana helps you breathe and relax, which in turn can help you adjust to the physical demands of pregnancy, labor, birth, and motherhood. It calms both mind and body, providing the physical and emotional stress relief that her body needs throughout the pregnancy. The first trimester of pregnancy can be exciting and scary. A woman's body goes through a lot of changes. Some of these changes may begin before you even know or confirm you are pregnant. It can help to know what to look for and expect so you can prepare. Feeling very tired is another common symptom of early pregnancy. Your body is working hard to adjust to all the new physical changes. This can cause extreme fatigue. You may need to sleep longer than usual at night. If possible, you can take short naps during the day. Your energy will most likely return in the second trimester of the pregnancy. What other changes that can expected in the first trimester? That is frequent urination, constipation, visible veins, skin changes, breast changes, vaginal changes, and a growing belly. Changes in the second trimester. The second trimester is often defined as a weeks 13 through 26. During this time, your baby continues to grow and develop almost daily. This means your belly grows more and you will notice other changes. Most women who did not feel good in the first trimester of pregnancy usually start to feel better in the second. The nausea and vomiting from morning sickness should lessen over time. You may have more energy and fewer mood swings as your hormones balance out. This is a good time to tackle many tasks necessary to get ready for your baby. Be prepared to gain weight more rapidly this trimester. Your breasts may not be as tender as they were in the first trimester, but they will continue to grow, enlarging milk lines and deposits of fat that cause the growth. These changes prepare you for breastfeeding. You may notice that the skin on and around your nipples darkens. You may also have small bumps around your nipples. These bumps are glands that make an oily substance to keep your nipples from drying out. A yellowish fluid called colostrum might begin to leak from your nipples. As your body grows, some areas of skin may become stretched tight. Elastic fibers right beneath the skin may tear. This creates streaks of indented skin called stretch marks. Stretch marks are likely to occur on your belly and breast. Increase sensitivity to the sun. This means you might burn more easily. Make sure you wear sunscreen when spending time outside. A dark line, linea nigra, down the middle of your belly from your navel to your pubic hair, patches of darkened skin on the face, sometimes called the mask of pregnancy. What other changes are expected during the second trimester? Leg pain, puffiness, backache, pelvis and hips pain, stomach pain, pain or cramping, heartburn, urinary tract infections. Changes in the third trimester, mainly they involve the varicose veins, hemorrhoids, tingling and numbness, backache, pelvis and hips, abdominal pain, shortness of breath, breast growth, more weight gain, less fetal movement. Things to consider sleeping. As you get better, you might have difficulty finding a comfortable sleeping position. You may also find it harder to change positions while sleeping. Side sleeping will be the best. Try to fall asleep on your left side. This will help circulation, which is important for the baby. If you wake up, return to that position before going back to sleep. Putting a pillow between your knees or behind your back make you comfortable. Sleeping on your back will be uncomfortable because the weight of your baby presses on the veins in your lower back. Also, this can slow down the blood flow from the lower body to the heart. To deal with these all symptoms which occurs throughout the pregnancy, practicing of particular yogasana and pranayam under guidance of yoga teacher during complete period of pregnancy helpful for a success outcome. These are the asanas which can be performed in the first trimester, second trimester, and third trimester. Next slide, sir. First is Sukhasana. The easy seat pose is a soft, comfortable seated position used during yoga and meditation practices. You can use this pose anytime you like to relax and take a few moments to breathe. Sit in the pose for as long as you like and use it as its own meditation practice or with a series of yoga postures. This improves the digestion, loosens up back muscles. The Vajrasana position has also been known to boost blood circulation throughout your body. Second is Baddha Konasana. Ideal pose to practice during pregnancy is that it massages the internal organs and improves digestive circulation. And anyone who's been pregnant will know that digestion is prone to become sluggish at various stages of pregnancy. It also soothes sciatica pain, a common ailment during pregnancy. Marjarasana. It is known for flexibility in the neck, shoulders, and spine area. It also helps to tone female reproductive system. Malasana, squat or garland pose. This pose helps to open up the hips and is a great pose to practice Kegel exercise and pelvic awareness exercise, as well as the breathing exercise and breathe for labor. Ensure your hips and knees are at 90 degrees and you are supported using cushions and rolled blankets. It is advised not to practice deep and unsupported squats after week of 34 of pregnancy or once the baby's head is engaged. Final resting pose, corpse pose is ultimate relaxation pose, lying flat on your back with or without props to ensure maximum comfort. This pose is generally taken at the end of a yoga class as it provides a few moments to let all the work done throughout the class settle into your body. This pranayam should be practiced in the discussion. Pregnancy, the relation between a mother and a fetus is a unique symbiotic union. Many more women are now getting married late and starting pregnancy at a relatively advancing stage, and this poses. Yoga and pranayam should be practiced based on the current health status of the pregnant woman. Supine and inverted poses in particular can decrease the edema of the legs because they improve draining of the retained fluid from the limbs. At the same time, they are done in a way that opens the rib cage and facilitates breathing. They improve the blood flow from the periphery to the trunk, so the blood flow to the vital organs of the mother and the fetus is also improved. The changes in the mother's digestive tract are caused by the fetus, which is crowding her abdominal organs and exerting pressure on her diaphragm, and also by the progesterone in her body. As a pregnancy supporting hormone, it limits contraction during pregnancy. It also, however, limits the peristalsis of the smooth muscles of the digestive tract. Yogasanas can help with difficulties such as heartburn, constipation, and also prevent the formation of gallstones and stagnation of urine in ureter. Supine positions or twists are helpful because of their stimulating effect on the entire digestive system. Conclusion: pregnancy and delivery are natural phenomena. It is a part and parcel of motherhood of every woman. Present day scenario is so complicated that there is addition of new conditions like late conception, conceived after infertility treatment, bad obstetric history, risky pregnancy, etc. To overcome all these lifestyles cause consequences, the only way is to follow a healthy lifestyle. Follow Ayurveda, practice yoga and pranayam. Only a healthy couple can plan for healthy progeny. Preconceptional care and regular antenatal care bring fruitful results. Practice of yoga and pranayam should be a part of dinacharya and garbhini paricharya. Successful antenatal care should be complemented by our age-old practice of yoga and pranayam. There are mistaken notions about yoga for pregnant women. Some women fear that it may lead to miscarriage. This is, however, nothing but an old wives' tale. Women should begin to practice yoga before conception to improve maternal health and ensure sound health for future generations. Yogasanas are, however, non-violent, improve blood circulation, and strengthen the body. These are meant to avoid the problems occurring during high-risk pregnancy and delivery. These are the references. Thank you.
Thank you, Dr. Vandana. Next, I invite Dr. Chedana Suresh Shinde for the paper presentation. Dr. Chedana, are you there?
Yes, sir. Am I audible, sir?
Audible, doctor. Please share the screen, doctor.
Sir, please share for me.
1 second, doctor. I'll share for you. Dr. Chedana, please start the session.
Thank you, sir. Good evening, everyone. Myself, Dr. Chetna Shinde. My topic is cellulitis. Next. Definition. It is spreading subcutaneous inflammation caused by streptococci, which produces streptokinase and hyaluronidase. It excretes inflammatory cells and protein of the cells, resulting in gross swelling of the affected part. Excretes is the meaning of excretes is oozing out. Risk factors. Next, sir. Risk factors: major and minor injuries, weakened immune system, that is leukemia, HIV, and certain medications. Skin disorders such as atopic dermatitis, athlete's foot, long-term chronic swelling, history of the cellulitis, being overweight, and snake bites, scorpion bite, or any animal bite or a scratch. Precipitating factors: diabetes mellitus, low resistance of the body to the infection. Next, sir. Common sites of cellulitis are commonly found where loose connective tissues are present. For example, lower limb, scrotum, face. Next. Clinical features: Inflammation like redness and itching. Skin is stretched. Fever, pain, acute lymphadenitis. Next, complication of cellulitis is blood infection called as septicemia, bone infection called as osteomyelitis, inflammation of lymph vessels, meningitis, shock, tissue death, that is gangrene. Next, prevention of the cellulitis. We can inspect feet daily, moisturizing skin regularly, trimming your fingernail and toenails carefully, promptly treating infection on the skin surface such as athlete's foot. Next, treatment of the cellulitis, bed rest, elevation of leg, local magnesium sulfate application, that is MgSO4, antibiotics, penicillin, ciprofloxacin, and others, analgesics, anti-inflammatories, multivitamins. If patient is diabetic, injection insulin is required. If patient is having snake bite, anti-snake venom is required. If insect bite is there, injection Avil and injection Dexa is required. These are the some pictures of cellulitis. This is face, leg, and next. This is the next slide. You can see the difference between two legs. One is affected by cellulitis and one is normal leg. Thank you.
Thank you, Dr. Chedana. Next, I invite Dr. Shubham Pidambar Patel for the paper presentation. Dr. Shubham, are you there?
Yes, sir. Hello.
Okay, doctor. I will share for you, doctor.
Yes. Hello, sir. Can you please share the screen?
Start the session, doctor. Screen is visible?
Yes, sir. I'm from Satyashrang Ayurved Mahavidyalaya. Title of presentation is Clinical Study of Sandhigat Vat with special reference to osteoarthritis and its management by Panjab. Abstract. Sandhigat Vat is the commonest form of cardiac is a type of which occurs in the which needs everyday activities such as walking, bathing, etc. Thus making patient disabled, handicapped. It being and occurs makes it of disease. Also with the Sandhi show and of movements of the joints or painful movement of joints. Words, sir, please change the slide. Osteoarthritis is more in the second and is extremely common by age 70. Almost all persons by 14 pathogenic change in weight, bearing joint, 25% females and 60% males. Osteoarthritis, a type of arthritis that occurs when to ends of bones. The wearing down of the tissue at the end of the bones occurs gradually and worsens over time. Joint pain in the hands, neck, lower back, knees, or hips is the most common symptom. In Western medical science, mainly analgesics, antibiotics, or surgery are options for the treatment of osteoarthritis. Don't provide remarkable recovery, but cause great adverse effect. Samprapti, Vat Prokop can occur in two ways. And Myojanya. Wagbhat clearly explained that Dhatukshay Nidans are also responsible for the meditations of the Vata. Along with the Prakriti Vata condition, the other dose such as cough and the Sandhi and does the Avran of Vata. Due to Avran, the Avruta Vat becomes strong and agitated, leads to further thus producing the symptoms of the Sandhigat Vata. Due to the Avran of the two to the pathway of Vata, it will not be proper. to other dhatu leading to Vat Vikas. Need and scope of study. Osteoarthritis is the most common disease in the world population in India. This disease is expected as fourth leading cause of disability by year 2020. According to the modern science, the disease is managed by analgesic drugs, corticosteroids, etc. Potent analgesics and anti-inflammatory drugs run the risk of producing side effects like gastric erosion, hepatic and nephrotoxicity, etc. Whereas such type of condition can be better treatable by the management and produce procedures mentioned in the Ayurvedic classics. These treatments are economical and they have long-lasting effects in the chance of recurrence are less. Aim and objectives for the effect of to observe the effect of Panchikta Grudh Gugul with Abhyanga Nadisvedan in Sandhigata Vata, to observe the effect of only Abhyanga and Nadisvedan in the Sandhigata Vata, and to compare the difference of result in the above treatment groups. Material methods: patients suffering from osteoarthritis were selected from OPD and IPD of SSM and Hospital Nashik, including classical signs and symptoms of Sandhigata Vata are Shula, Shota, Sparsha, Asatva, Sputan, Akunjan, at the joint. Patient between the age group 30 to 70 years, patient with the below 30 to 20 years, patients like DM, diabetes mellitus, carcinoma, psoriatic arthritis, polymyalgia. Hello.
Hello, doctor.
Yes, doctor, you're audible. Please
Hello.
continue.
Yes, ma'am. Grouping, ma'am, audible. Hello.
Hello, doctor. Can you hear my voice, doctor?
Yes, sir. Hello. Sir, am I audible?
Doctor, you are audible, doctor.
Yes, sir. In these studies, maximum 44.89% patients were found in 41 to 15 years of age group. 59.18% were female, 93.87% were Hindu, and 95.91% were married. 37.73 were primary educated, 14.81% were housewives, 53.06% belong to lower middle class, 81.63 were from urban area. 36.73 has Samshan type of habit, and 85.71% have got gradual type of onset, found in chronic stage. 85.71% were aggravated symptoms in cold season. 67.34% were having negative family history. 69.38% had Madhyam Koshta. 69.38% were having irregular bowel habit, and 40.81% was in menopausal state of life. Vat Kapha predominance was found in 55.10% of patients. 81.60% patient had got Madhyam Sar. Madhyam Sanan was found. 83.67% of patients and Pramanata Parikshas Tulya was found in maximum number of patients, that is 51.02, and Madhyam Praman was found in 32.65% patients. Knee is one of the big weight bearing joints, and thus 93.88% was found in involvement of knee joint. Involvement other joint, that is hip, ankle, shoulder, were found 13.61%, 6.12%, and 8.16% respectively. Divaswapna was found prevalent 65.30%, and Ati Ruksha Ahar, Ati Snehan Ahar, Ati Vayam, Ati Alap Ahar among the risk factors patient of female. Obesity, psychological stress was found prevalent. Panchatikta Grudh Gugul, along with local Abhangya and Nadisvedan, that is group A, has provided better relief in the disease Sandhigat Vat, osteoarthritis, in the present study. In both the groups A and B, that is 15.38 and 0.14% patient achieve complete remission, while 61.54% and 14.28% found in maximum improvement of the symptoms. No patient found in mild improve in group A, whereas 14.20 mild improvement in group B. No patient found unchanged in both the groups. In the present study, in affected patient knee, X-ray was done before and after the treatment, but no changes was observed in any X-ray. No significant changes of serum calcium was found before and after treatment. It shows that there is no direct role of serum calcium in the etiology or in the prognosis of osteoarthritis. Serum calcium level was found elevated both before and after treatment in female patient of premenopausal or menopausal period. That may be due to the osteoporotic changes of bones due to lack of estrogen hormone. Probable mode of action. Sandhigat Vat is a madhyam rog marmagat vikar disorder in which vegetated vat gets lodged in sandhi. Hence, to treat sandhigat vata, drugs acting on both vat and asti should be selected. According to Charak, in asti dhatu dushti, the treatment should be given tikta dravya, grit, and shira. In Panchagrita Gugul, predominance of tiktaras is there. Tiktaras has Vayu and Akash Mahabhut in dominance. Hence, it has got affinity towards the body elements like Asti having Vayu and Akash Mahabhut in dominance. Though Tiktaras aggravates Vayu, which may enhance the pathogenic process of Sandhigat Vat. But the main principle of Ayurvedic treatment is Stanam Jaite Purvam. The main site of Sandhigat Vat is Sandhi, which is the site of Sleshak cup. So by decreasing the cup dosh, Tiktaras fulfill the principle. Most of ingredients of Panchayikta Gugul have Tiktaras, Ushnavirya, and Madhur and Katu Vipak. Conclusion: Sandhigat Vat is one of the Vat Vikar and it is Yapya Vyadhi. South Asian countries like Bangladesh, India, Nepal, Sri Lanka are having higher incidence. Sandhigat Vat, vice versa, osteoarthritis is multifactorial non-inflammatory joint disorders. The data shows that Panchayikta Grut, along with the local Abhyanga and Nadisvedan, that is group A, has provided better relief in the disease Sandhigat Vata. In the present study, in group A, patient achieved complete remission while 61.54% patient found in maximum improvement and 23.0 having moderately improvement. Present study reveals that the selected management have potential effect of Sandhigat Vat with the added advantage of being free from side effects. Thank you, sir.
Thank you, doctor.
Okay.
Let's invite Dr. Rohini Ramesh Arsul for the presentation. Dr. Rohini, are you there? Dr. Rohini Ramesh Arsul, are you there? Okay, next I invite Dr. Vaishnavi Anil Sarangdar. Dr. Vaishnavi Anil Sarangdar, are you there? Dr. Vaishnavi Anil Sarangdar, are you there? Okay, I think today's presentations seems to be over. I would like to invite Dr. Aishwarya Aras to conclude the session. Dr. Aishwarya.
Thank you, Dr. Sabin. So it's an official end of Grahya, and it's again happened only because of you. Thank you so much for joining with us. And on behalf of Team Ayurapta, I extend my sincere gratitude to all our faculties for being with us from the beginning. And thank you all, dear participants. Keep showing your interest. We'll see you soon. Thank you all.